Hi, everyone. Welcome. I'm Shivan Sarna. It is such a pleasure to have you here today as we are going to be taking you through the Flowchart to help you with your SIBO, small intestine bacterial overgrowth. I am honored to have you. I know Dr. Siebecker is as well. We have just a couple of rules that I want to take you through real quick. First of all, just because it is a public forum, be nice or be gone. That's all. The kitty cat with the butterfly. The kitty cat's being nice to the butterfly. So that's just a personal policy we have at Sibo SOS and the projects that we do. It is a huge, huge audience. And now enough of that. I'm not worried about it, but I do like to mention it just because it's a wild, wild west these days. Okay. Next up, I wanted to let everybody know that you have a goodie that you can, you'll have a lot of resources from this session and you will be sent the recording. So I want everyone just to sit with me for a second and take a breath because SIBO panic is real. It's okay. You're going to be okay. We're going to help you get there. SIBO is manageable. It is in many cases curable. So I know that's a big question that I see all the time in a Facebook group that we have called the Sibo Sos Community, and I need to stream it there live right now, Allison. That was the thing I forgot to do. Okay, thank you. Good one, Shivan. So you will be getting the information that Dr. Siebecker is talking about in the stay to the end, because it'll be worth it to stay to the end. And we're going to do a really juicy Q&A session. And as I was saying before, Dr. Siebecker and I are very serious and very focused on this, but we're not perfect. So we like to be, relaxed about these things. And so we're not beating ourselves up. If we have a little glitch, don't do that to us either. I appreciate it. Okay.
Oh, and I may have to, if you see me turn off my video at some point, it's probably just because I have to take a restroom break. So
right. That's it. We all have to do that.
I drink a lot of water when I speak, when I lecture. So
okay. I just want to make sure we're live on Facebook. There you go.
We are. If you see me turn off my.
Okay. Back to us. All righty. So the next thing that I just wanted to mention is, this is going to be hard. This may very well be the most difficult thing we do together today, and that is to turn off all your distractions. Can you do it? Can you turn off your phone right now? Can you shut the door or put a note on the door or just claim this time as your own? Challenge, I hope, is accepted. So in the chat box for technical issues and links, Q&A box is where you get content questions posted. Don't repost. Like if you think I don't see it or something, please don't repost it because it overwhelms me. And so I do a pretty decent job of getting through to as many as possible, but try not to repost if you don't mind. And please be sure to sign up for each of the virtual training sessions that we have coming up. Today, obviously, you're here. Thank you. The 18th is part 2, which is the 4 types of SIBO and IMO and their treatments. And then on the 20th, it is the most overlooked part of SIBO treatment, which we're going to touch on a little bit. So you'll know. We didn't mean to be mysterious, but now it's a pleasure to introduce you to the world-renowned Dr. Allison Siebecker, award winner. We're very proud, very, very proud of her. She is the one who has led the way for so many other practitioners and healthcare providers and patients to figure out what has gone on with their small intestine bacterial overgrowth. She is a patient herself. She is my friend. She was my doctor who became my friend. I'm very proud to have her as a dear, dear friend. And we have a joint mission of helping people to become better and well from this condition and share our stories. This is the book that I wrote, Healing SIBO, which Dr. Siebecker read every single word, bless you for that, and wrote the foreword to. I talk about it pretty incessantly in the book because so much of what I talk about in the book is my story, but also the algorithm that you're going to be learning today. And the book is based on that. And then here we are in matching sweatshirts and we're adorable. Thank you. Okay. Here we are. Dr. Siebecker came to Florida And we recorded some trainings and we had a blast. We went to the beach, we worked hard. And I just wanted to show you some of the behind the scenes. Here we are at a conference about small intestine bacterial overgrowth. So we've traveled, she's in demand all over the world to get her message of healing and how to do it out there. A little bit about me, I'm Shivan Sarna, and that's me on TV with the designer Heidi Doss. That's me behind the scenes. I'm a TV host for 20 plus years. This is our team. See Dr. Siebecker drinking her water during our team meeting. That is like a true BTS behind the scenes shot. And then this is Miles, our videographer and my dear, dear friend. He went to high school with my husband. I dated him for 12 years. He still comes to Thanksgiving. He's part of our family. And
this shows you what wonderful person Shivan is, that she's still really good friends with her ex-boyfriend.
And I've been married for 17 years now to my amazing husband, and their friends too. So that's Miles carrying the luggage on our trip. He was not happy at that moment. We were very tired after flying all the way to I don't know where we went, Portland. I want you to stay until the end because we have some very special things for you, including the algorithm itself and including a bonus handout on Sibo symptomatic relief that you will definitely want to share. We're going to stop sharing now. And I just wanted to get that to you all, so a little bit of the details. So we keep you interested, intrigued, and learning this whole time. Believe me, you will not be disappointed by the end of our session together. I want to encourage everyone again, just to take that breath and know that we're going to be delivering the information for you on what to do next for your small intestine bacterial overgrowth and IMO. And we're going to be talking a little bit about the terminology as well as what pitfalls to avoid, etc. So when you are with us today, the promise is that you will have more information that you can work with your doctor. You can also do yourself. And the proven method for planning and managing your SIBO treatment for that optimal result is going to be revealed to you. And then we're going to give you some resources if you care to participate. It's not, this is if you want to, great. If not, we don't want to waste anyone's time. And the story is this. I was a TV host for 20 years at Home Shopping Network, HSN in Florida. If you know it, great. If not, no big deal. But it is the 10th largest television station in the United States. And I was starting to not feel well and started to not feel worse. I started to feel worse and worse and worse. And maybe you can relate to the bloating, the alternating constipation and diarrhea, the fatigue, the pain in the belly. People were writing me periodically, not all the time, because I was really managing my condition with a lot of Spanx and, stuff to hold me in. And, people were asking me when the baby was due. Yeah, that's an uncomfortable post on Facebook to when you are not pregnant and really beyond childbearing age. Moving on. Anyway.
By the way, that happened to me. That has happened to me too.
Has it?
Oh, yeah.
Did that happen to anybody else?
Oh, yeah. It was mortifying.
It's really, really
because
tough.
of the bloating, the extreme bloating.
The extreme bloating.
Oh,
yeah.
So you're, I think what somebody said to me, so you're carrying. And I'm like, yeah, I guess a lot of gas.
Yeah, my purse. So there was a checkout guy as well at this local, I've told this story before because it was kind of traumatizing. He was like, this checkout guy at the grocery store, he's like, oh, when are you due? And I was like, that's my lunch. I said, how old are you? He goes, oh, I'm 17. I'm like, listen, don't ever ask a woman that. There you go. You're welcome. Anyway, yeah, I was skinny too. I was tiny. Yes, my heart goes out to anybody who's ever had that experience because it's not a feel-good moment. But just I wanted to share with you that, that's just one of the moments that I remember. But I've had small intestine bacterial overgrowth from food poisoning since I was 5. And Dr. Siebecker as well. That's when we first were exposed to it. And it's life-changing, let's face it. And it causes other things. And Dr. Siebecker will talk all about that. But I wanted to make sure that you understood the backstory about how we come to this. So there are as high as 25% of the population of the entire planet have irritable bowel syndrome. More than 40 million people in the US. Okay, and I realize we have a global audience today. as always, thank goodness. We've had millions and millions of views of our work together to help people with this information. Most of it has been free, and we are so proud of that because we truly are joined in this mission. So normally it takes about 5.5 years to get diagnosed. 5.5 years. Holy smokes. Who here has had at least 5 years before you got a diagnosis of small intestine bacterial overgrowth? Just pop it in the chat if that's you. How many years was it? Or if you can't even remember, you just know it was more than 5. The average is 7 doctor's visits. Now, just for perspective, if that is 25% of the population having IBS, 10% of the population has diabetes. And celiac, I don't know if you know this or not, is just 1 to 2% of the population. So, you know, everyone's so gluten focused, and I understand why, but when you hear about who has celiac, it's 1 to 2%. And you see all this media and information, and understandably so, about diabetes, understandably so. IBS, 25, a quarter of the planet. And thanks to Dr. Mark Pimentel, we know that the vast majority of that is caused by food poisoning. And yes, there are other underlying causes, we know. So I just wanted to kind of give you,
if I could just interject,
please
we
do.
know 60 to 70% of IBS is SIBO.
Thank you.
Yeah.
Yeah, no, right on, exactly. 3 years, but only 2 doctors. Kathy, that's fantastic. Honestly, I know you feel like probably you've been through the ringer, and I'm sure you have, but that is fast. 50 years, 5 years, more than 20 doctors over 2 years, 3 years. Yep. 5 to 7 years. Yeah. 5. I'm with you. We're all with you. Okay. So we want to give you context here. And what happened for me was that I felt incredibly alone. At one point, my brain fog was so bad, I literally could not speak. I started to stutter. I'm getting goosebumps. I started to stutter, and like words wouldn't come out of my mouth that day. And David, my beautiful husband, looked at me and he went pale because he was like he thought I was having a stroke, honestly. And I previously to finding out that I had small intestine bacterial overgrowth, thought I had cancer, which is in the book about why I asked my doctor, the incredible doctor that I found in Florida, who I helped to train in small intestine bacterial overgrowth. I asked him to do colonoscopies for me up until like the last day before Christmas. His office was going on vacation, and I begged, crying, to have him give me a colonoscopy because I thought I was dying. So that's a very dramatic moment in my life. And he went in there and he said, Shivan, I don't see anything. You're fine. You're fine. Bless his heart for helping me in such a traumatic moment and emotional moment for me. But I had to train him. He thanked me. He happened to be a very special doctor who's still, thank goodness, practicing. But he thanked me when I walked in with studies. He thanked me when I would tell him things that and give him like little dosage tips and stuff. And he said, they just don't teach us this in medical school. Great. And he has become a better doctor because of that. And not all doctors have that attitude, right? Obviously, we're not doctor bashing. We love them and appreciate them. And I'm just saying, I know a lot of you can relate to that. And it's very maddening and frustrating. And today we're going to help you get it right. So we are going to get you that roadmap, flowchart, algorithm, whatever you want from the people who originated it. And we'll show you how it is proven, which we have some great stories for you. So I'm going to keep going here. So that's what we're going to do. We're going to shed that light, and we're going to help you with your struggle. I want you to stay to the end, because if you do, as I already told you, you're going to get a copy of this algorithm, and you're going to get Dr. Siebecker's gold called the Symptomatic Relief Guide, which I will show you in another minute or so, or I'll pop in with it later. And you'll see that it is crammed on 2 sides of this page with things that will help you in the moment to feel better. And it's really the equivalent of maybe another like 25-page book or 30-page book, but Dr. Siebecker challenged herself to put it all on one sheet so that you could have it like in the bathroom, in the kitchen, because you're going to get a lot of relief from that. Okay, so would you do me a favor and just pop into the chat with one of your worst symptoms? It doesn't have to be in order of importance. Just what's one of your worst symptoms? And that is what I want to know. How many of you can relate to bloating? I'm getting in there. Yep. mood swings, bloating. Yep. Pain. Who has pain? I normalized my pain. And then I learned about the term visceral hypersensitivity. And I was like, oh, it's a thing. And then I found out that like not everybody else has the kind of pain that I have, but it is from this condition. So it was phenomenal to realize that how much I had normalized things. Dr. Siebecker, can you relate to that?
Oh yeah. Well, for me, I don't know that I normalized it. It's just, but it is your normal, right? So I'm the same. I had IBS, SIBO since I was 5, bloating, constipation, and terrible abdominal pain. I would be up all night with it. It was really, really awful. And I didn't get relief until around 45. So from 5 to 45. Yeah.
Well, so that's about my age range too, even though we both look amazing. Oh my God. So here's what happened for me. This was the turn. I'm sorry, you guys. I'm just having fun. I'm so glad you're here. Dr. Siebecker and I have been working on this for so long that I'm just like, I woke up this morning, I leapt out of bed and I was like, it's finally happening. Yay. So what happened for me was I really hit rock bottom. I had never gone to a gastroenterologist before. I went to one and he told me to run 3 miles and he gave me an antidepressant. And it is very isolating. I am a prayer warrior. I can't even tell you how much I prayed and meditated. And it was like a part-time obsession. It wasn't an obsession of mine. How am I going to get better? I have to get better. This has to not be the way the rest of my life is. I thought I had cancer, on and on and on. So I went to a doctor. We call him Dr. Run 3 Miles in the book because he was getting ready to retire. And he was very famous in GI worlds in Florida for doing scopes, but not staying up to date with the latest information. So he gave me this old, horrible Xerox, and I do mean the word Xerox, like an ancient low FODMAP diet page. This looks like a New York Times bestseller compared to what I got, okay? And then I, thought, oh, okay, I'll change my diet. And I did start to feel better, but I couldn't go walk 3 miles or even run 3 miles. I could barely even think about that. And I did not do the antidepressant because he didn't explain to me why he even gave it to me. I thought he thought I was crazy. I was really insulted and confused and upset and frustrated. So anyway, I of course went to Dr. Google. I spent hours and hours and hours and hours and hours and hours and hours on Dr. Google, going down these rabbit holes of like obscure blogs and just, if you've been there before, because believe me, right now, it is like an information superhighway with resources, thanks to this one, Dr. Allison Siebecker, and the work at Sibo SOS and SIBOinfo.com. I mean, that's really tremendous, the progress that has been made in the last few years. And anybody who's been doing this for 5 years trying to figure out, what it was like before this. So anyway, I found Dr. Allison Siebecker, Sibo specialist, online in Oregon. And I thought, oh my gosh, look, she does remote consultations. Will that help me? She's not in the same room with me. Wait a minute, what? And I was like, screw it, I gotta try it. She wasn't taking clients at the time. She was on sabbatical doing some research. So every day for about 6 months, I went to her website like a crazy person. And one day she had opened up appointments and I started to cry. I was so excited. Now, at the time, I had a credit card with some room on it. So I booked like 8 appointments. I was like, I'll do this one. And then, okay, in a couple of weeks, we'll do another one. I mean, I was like, she must have thought, who is this? Who is this person fogging up my inbox? But anyway, I booked a bunch of appointments and I met her. And after my first appointment, I got to tell you, my life changed. My hope went from below 0 to infinite. And that's what I want you all to have today. I am so silly emotional. And moving on, Dr. Siebecker has never seen me tear up before, except once. So anyway, it was a godsend, and I mean that literally for me. She showed me what, in a different form, what we're about to see from her. And it gave me hope. It gave me a plan. I have a lot of Virgo in my chart, so I love like organization and stuff. She's an incredible teacher, incredibly organized, a wonderful communicator, a wonderful person who is truly an award-winning, world-renowned SIBO expert. So it is a pleasure to share this with you and to bring to the forefront her information. And with that, Dr. Siebecker, I would love to have you do your thing.
Okay. Thank you for that introduction, Shivan. I want to tell you, so we're going to talk about the algorithm today, Flowchart, Sibo Flowchart. And I want to tell you what inspired me and Shivan and us to put this topic on today. And it's just a little story. So recently I was talking to a friend and colleague who is very active, very, very well known, very active in the online health world. And he focuses on gut health. And he apparently had been talking with other practitioners about problems that they face in treating SIBO. So from a practitioner perspective. And we were discussing this. And after a little while of listening to me talk and kind of offer solutions and just talk about it, he said something like, you make it kind of almost accusatory, a little bit. You make it sound like you've got a chart in your head showing you what to do for SIBO with the next steps and all the treatments. And like as if there's a map in your head or a chart. He said something like that. Shivan and I were both on the conversation. And I was just totally taken aback. I'm like, I do have a chart in my head. Yeah. And I wasn't even the person who originally created the chart or the roadmap. It was actually the famous, wonderful Dr. Mark Pimentel. Dr. Mark Pimentel is the leading researcher in SIBO. So let me share my screen. And I'm going to show you, for those of you who don't know him, Dr. Pimentel. So let me see here.
Good looking man, just saying.
Mark,
because his spirit shines through, Dr. Siebecker.
Oh, he is the nicest person for anyone who's spent any time with him. And he's dedicated his entire life to helping people like us. His goal is to cure IBS. And, for people who have SIBO, and we're focused on SIBO here in EMO, we know that 60 to 70% of people have IBS. And really, so he's focusing on that. He's focusing on the SIBO and the EMO piece. So anyway, Dr. Mark Pimentel, let me just tell you the history of basically this flowchart I'm going to show you. He put together this flowchart, a version of it, his version of it, the first and early versions of it in the early 2000s. And he spent many years studying the various steps in it, the elements of it, and also how it all went together. And he would publish his results, like on each of the steps. He would do research and publish his results. And then he used it with his patients, this flowchart, for many years. So he validated that it worked, both with published research and in real life with his SIBO patients. And then, oh, by the way, hold on. I'm moving ahead here without showing you. This is where Dr. Pimentel works. He works at Cedar Sinai Medical Center in Los Angeles. This is the building he used to work in. It's called the Thalians building. And I visited him there. I'll show you a picture. So I went and precepted with him back in 2014, observed him in clinic, which is wonderful. And this picture of Shivan and Mark and I think that was 2018. It could have been 2017. We went to visit him to film him for some interviews and classes. But so anyway, let me come back to his. So he has new digs now, by the way. He is a big wig there at Cedar Sinai. He has a whole special research center. Shivan and I got a virtual tour of his new facility, but there aren't any pictures to show you of that. But anyway, so he used it for years with his patients, and then he finally published it in his book in 2006 and in research articles in 2006, and he published another early version in 2007. So basically, he spent years studying it and validating it, which is really important that you know. Now, I didn't even learn about SIBO until like 2009, something like that. Here he's published. I mean, did you all realize that there was a published flowchart for SIBO in 2006? I didn't even learn about SIBO till 2009. But soon after I did, I shifted my focus entirely to SIBO. And my colleague and I, Dr. Sandberg Lewis, co-created a SIBO specialty clinic at the medical university where we teach. So we both teach at NUNM in Portland, Oregon. And for those of you who don't know, I teach advanced gastroenterology. I have been teaching that there since 2013, and I teach it along with Dr. Steven Sandberg Lewis. We call him SSL for short. He is a veteran. Let's see if I have his picture here. Yeah, look at this picture of him looking like he's Mr. Bean. I found this picture, I thought it was hysterical. He's a veteran naturopathic gastroenterologist who's been teaching gastroenterology for over 40 years in other subjects. He's really a legend in our field. So he and I joined forces together, and we created the first ever SIBO specialty clinic at our university back then. And when we began our work, we used, let me see, I think I've got do I have another picture here? Where's oh yeah. That, by the way, I have braces in this picture. You can't tell because it's a fuzzy picture. This was like one of our promo pictures when we opened the center.
Which, by the way, does the Sibo Center still exist the way it did before?
It doesn't exist in the same way as when we created it. I believe they have it in name. I probably shouldn't say anything about the people who are working there. I don't know. It's not the same as when we're not there. So it's not the same as when we were there. When we were running I was the medical director. We're no longer there. So, okay, where was I in my story? I have to remind myself. Okay, so the Sibo Center. So what we did is we took Dr. Pimentel's early versions of his flowchart, and we used them with our patients. And we pretty early on knew we wanted to make some changes to the algorithm. Some additions and some updates. One of the more obvious ones is we added herbal antibiotics as one of the, not just pharmaceutical antibiotics, as one of the treatment methods, because that's one of our main modalities as naturopathic physicians. And we made other changes. Now, we also had other doctors working with us in the clinic and the community. And here's the really important thing. We ran before and after breath tests, SIBO breath tests, for every treatment that we gave. So every intervention had a before and after test. And that gave us a lot of data, a lot of immediate feedback, and it really guided us. And together, we all validated our version of the algorithm with our patients over many years, and added what was needed as we went on. And so we published our first version. This is, I think I have brought this slide up. Yeah, we published our first version of the Flowcharter algorithm in 2013, but we did continue to update it over several more years. Shivan actually helped with one of the final updates, believe it or not. Yay, Shivan. As we continue to work with our patients and see what else we needed to do to make it, just right. So I wanted to tell you the story because the history of it, so you would understand why we would say it's proven and how it is that I can feel confident to say that it works. It isn't from my ego or anything like that. It's because there's published studies on it, and both Dr. Pimentel's and my group's validation has occurred with our patients working many years with all of our extensive data. So I'm going to stop sharing my screen for a minute more, and because I want to go back to the original story. But so that is why we know that this algorithm is proven.
That's really a big deal to be able to say that. When I was doing all different categories at HSN, we could not say the word proven about anything. Like we could say shown or FDA approved or something. And by the way, what we're going to share with you is not medical advice. You need to use your own practitioners. You need to use the resources that I'm going to make available to some of you later on, that kind of thing, obviously. So what you're going to be learning today is great foundational information to spring yourself from, but proven. She can say proven, guys. That is so big. And of course, individual.
Validated. I prefer the word validated, but you get the idea.
Validated. I can say proven.
Okay.
Go ahead.
So going back to my conversation with my friend who said, it's like you have a chart in your head. It really did take me aback that he didn't seem to know really about any of this or any of the versions of this flowchart. And it really did help me realize just how few practitioners even know about the flowchart. Even though I've certainly been teaching it for years at online classes, at SIBO conferences, at other conferences in medical school, but so many practitioners don't know about it. And that means it's making it so much harder for them to help you as SIBO patients. And the really good news is that you can have it in your head just the way I have it in my head, or maybe more practically, you could keep it in front of you because you might not be memorizing it the way I do. Keep it in front of you and look at it as you make your way through SIBO treatment. And you can also share it with your practitioners. Personally, I would feel absolutely lost if I didn't have this kind of framework in my head. It totally reduces the overwhelm so many practitioners feel when they face SIBO. Patients feel it too. And it reduces the overwhelm and it makes a very clear path to guide me through treating people's SIBO. I very strongly and highly advise using this framework to guide you through your SIBO treatment. Okay, so let's take a look at it.
So the pedigree of this, proven, Dr. Pimentel, Dr. Siebecker, Dr. Stephen Sandberg Lewis, thousands of other practitioners and patients around the world have used what you're about to see, but not everyone knows how it works. So this is what's so important, that you're learning from the, one of the original contributors to it.
Thank you, Shivan.
It's true.
Okay. So first, I just want to, I want to do that thing where I can make my,
You're going to go whole screen.
Oh, I think I'm pretty whole screen.
Oh, okay. Let me see.
I was going to do the thing, if I can figure it out quickly, where you make your pointer be more visible. I think it's, no, that's going to be a highlight. All right. My technical skills are not completely perfect, but anyway, here we go. So I want to just take you through it briefly and generally first, and then I'll come back and go through the specifics. So at the top, you suspect you have SIBO, and how you suspect it is from symptoms, and history. Then typically people are trying various supplements to help their symptoms and changing their diet. If this doesn't do the job fully, then what we do is we move on to properly diagnosing SIBO, really finding out if this is what we have. We do a breath test for that. That's here. Then we move on to treatment if you have SIBO. And treatment primarily consists here of various types of antimicrobials, pharmaceutical antibiotics, herbal antibiotics, or elemental diet. These all reduce the overgrown microbes, basically the bacteria and the archaea. And down here, I just want to point out these weeks. This is what one treatment round typically is for each of these types of treatment. So typically a treatment round is 2 weeks for antibiotics, 4 weeks for herbal antibiotics, and 2 weeks for elemental diet. Now, this whole section here is, can you make it bigger, Dr.
Siebecker? They're saying they can't see it. It's like a gray screen surrounding the algorithm. So is there a way to make it 100% or something?
Yeah, I'll just go bigger to the parts I'm talking about.
Okay, cool.
Better, you guys? Can you see this better?
I can definitely see it better. It's not taking up my whole screen, which is weird. So if anyone has a technical comment.
Yeah, I mean, this is, for me, on my end, it's taking up my whole screen.
Oh, okay. That's
so I'm not sure how to make it any bigger,
Okay, cool. Just, zoom in. That's really helping. Thank you.
Do you want me to zoom in more? How about like this?
Dig it. Love it.
Okay, so we've just gone through SIBO suspected first and second line therapies, getting the test, and here's the treatment. I'm talking about the antimicrobials right now. This here is going to be the subject of webinar 2. I'm going to spend an entire webinar on this, on webinar 2. We also have Sibo Diet. Now, if you'll notice here, the antimicrobials, they have lines coming from this treatment box, going to each of them, and then going down to prokinetics. But Sibo Diet doesn't have any like hard lines going to it. And this was a hard one for me to figure out what to do on the flow chart, because A Sibo diet can be used anywhere along the process of the flow chart. It doesn't just have one place to be. So I let it sort of float out here on its own because you could use it anywhere. Now, after you do your antimicrobial treatment, we typically do a prokinetic. I'll explain what that is coming up. And that's to hold the gains we've just made from reducing the bacteria somewhat in our treatment. Next, you assess how everything's going. How did the treatment go? And if it went very well, and if the person is better, if they're better, we move on to prevention of relapse. And that's here. Now, over on this side, if a person was not fully better, that's when we like to get another breath test, a retest, to check what's going on. And there's two possibilities here. Either SIBO was actually gone, but if there are still symptoms, then that means there's something else that is there causing those symptoms. So then we have to see what else might a person have. You got to figure that out. And then over here, if the test is still positive, that means, oh, are you speaking, Shivan? You're muted.
Sorry, when you're saying over here, where are you? Just talk about the box. Say the
I'm
name
so
of the
sorry
box.
because I can't get my cursor to look. I am so sorry I can't get my cursor to look better.
It's
I'm
fine.
over on the bottom right, and I just was discussing the two green boxes on the bottom right.
Great.
Now I'm moving over to the red and purple bottom right boxes where the test is positive. And then what you do if the test is still positive, because this is what most people's scenario is, we need to give more than one treatment round to get rid of SIBO. So what you do is you retreat. Now I'm going to shrink the algorithm for a minute because I want to show you that what happens is all the way on the bottom right, the purple box retreat. It might be a little hard to see, but there's a solid purple line that goes all the way up around the right-hand side, back up to the treatment box, up here in the middle, the big long purple box in the middle that says 3 treatments. And so basically what that means is you do another antimicrobial treatment round. And you would continue in that way, sort of circling through the algorithm for as many treatment rounds as it takes to get your test negative. And for many people, that's anywhere from 3 to 5 treatment rounds. Now, the last thing that I didn't talk about is the bottom left, the red box that says relapse. What if after, you've had success now, and you were good for a while, now you relapse? What happens then is there's 2 things to do. We want to try to figure out what someone's underlying cause is. Let me go a little bigger. Because that is what is causing a person to relapse most of the time, is that there's something there, some other disease or something that is causing SIBO. We need to figure out what that is and see if we can get rid of it. And then the other thing we do is we go follow this purple line over to the right, and we go back to the retreat box, which means you follow the big arrow up and around, and you treat again. So if you relapse, you just treat it again with antimicrobials. Okay. Now that is a very simplified explanation. And now I want to show you a few other things. I'm going to bring you over to the PowerPoint. Okay. So now I want to draw your attention to the black words on the sides. And by the way, how well are you seeing this version of the algorithm?
I switched my view, so I'm seeing it much better. So remember, everyone, if you have a chat box in front of it, you can use your cursor to move it. You can play with the view up top. People can see it perfectly better. Awesome. Keep going.
Fantastic. Okay. So, there's a lot of elements on this flow chart, a lot of boxes, there's a lot of lines, but I want to even simplify it even more, just to really get the sense of the phases that really the flow chart is bringing you through. On the top left here, the black word is diagnosis. We're just going to skip right down to the yellow box of SIBO Retest. The first thing you do is we're going to diagnose whether you have SIBO or not. Then we're going to treat it if you do. Then we're going to assess how the treatment went. And we're going to read now over on the right, bottom right, the black word retreat. We're going to retreat if it needs more rounds. Now coming to the bottom left, once we're good, we're going to move on to prevention. And finally, if a relapse happens, we will deal with that. So that is the simplified version of it. Diagnose, treat, assess, prevent, and treat a relapse if it happens. Okay, so now I want to take us through it more specifically and give you some more details. So we're going to start right up at the top. Now here, I think I can make my pointer into a laser. Yes. Okay, can you see my red laser?
Yay.
Okay, so right all the way up here at the top. Can you see me circling that?
I can.
Thank goodness. Okay. Okay, we're starting with suspecting SIBO. So you suspect SIBO based on the history, like for Shivan and I, we both had food poisoning. Of course, you'd need to know that that's a major cause of SIBO. So we've just told you, but more so it's the symptoms. So what are the symptoms of SIBO? Just briefly, the symptoms of SIBO are the main symptoms of IBS. They're the same symptoms as IBS. Primarily, the symptoms come from eating. The symptoms are triggered by eating, which is a horrible circumstance for all of us who have it. And the main symptoms that come are abdominal bloating, excessive belching and flatulence from that extra gas as it exits, abdominal pain, diarrhea, constipation, or both of those. SIBO symptoms also include general food reactions, most especially to carbohydrate foods. There can also be acid reflux, nausea, a sensation of food sitting in the stomach that won't go down. Very commonly, there's anxiety and brain fog. I saw a lot of people putting that in their symptoms. Sometimes there's depression. Anxiety is much more common. Fatigue is very common. And weight loss. Now, some people gain weight when they have SIBO, but it's more prevalent that people lose weight. And this is for multiple reasons. Actually, now I want to show you the algorithm again. A second here, just to talk about that.
Okay, has anyone else ever seen this algorithm before? Unless, I mean, have you come here and seen it before? Because we've been showing it to you periodically. Is this an eye opener for you? T's saying no, he's never seen it before. With us, yes, you have great Fatina. Randy, no, I've never seen it. Okay, does anybody feel better? Like that there is a map out there? Because I know I did. That is like, woo! Okay, back to you, Dr. Siebecker. I just wanted to acknowledge that like something good just went down, people. That was cool. Okay, thank you.
Okay. Okay, so the general course of action, once you are suspecting SIBO, and the reason you're suspecting it or wondering if you have it is because you have digestive symptoms. So the general course of action for both those of us who have the symptoms and practitioners is usually to try some basic interventions. And so let me get my little laser pointer again. Oh, no, I can't. On this screen, I don't know how to get that up. It's the second box, this purple box here that says first and second line therapies, diet, meal spacing, and supplements. This is to indicate basic interventions like changing your diet or trying digestive supplements like fiber or probiotics, very basic things people would think to try. Okay, now I want to come back to the PowerPoint.
Yeah, they like it best on the PowerPoint.
I will try and keep it on that then.
Okay.
I like it better that way too. It's easier for me.
Yeah. Yeah.
Good. We're all in agreement. So what are first and second line therapies? First line therapies are diet and lifestyle. So, these are the types of things you do when there's a problem and you're like, okay, I need to clean up my diet. So the most basic way of doing a dietary intervention is decrease processed foods and increase whole foods. We can move on to where a moderate level of intervention would be eliminating the common food allergies. And then last would be more advanced more like condition specific diets, like the low FODMAP diet or autoimmune paleo diet, something like that. But, so there's levels of which you might change your diet, but, cleaning up your diet, so to speak, of just decreasing processed foods does wonders for people and does wonders for their digestion. Now, over on the right, we have the lifestyle interventions that we all know about. The meal hygiene is making sure you're chewing enough, not snacking between meals. That's what meal spacing is. Then there's things like making sure you're getting good sleep, you're getting exercise, you're getting fresh air, and you're modifying your stress and handling your stress. So this is first line therapy. Second line therapy is Supplements and low risk modalities. So these are just the basic digestive supplements we would all think about, like probiotics and enzymes, digestive enzymes, bitters or hydrochloric acid supplements, fiber and prebiotics, short chain fatty acids like butyric acid, herbs like peppermint and ginger, these sorts of things. And over on the right, we have the low risk modalities that many people try, like acupuncture and all kinds of body work, massage, chiropractic, on and on. There's like 50 options there. Hydrotherapy, homeopathy, things that we don't need specifically to have a diagnosis of what's wrong to try and feel better. Things like acupuncture, they will get their own diagnosis from pulse and tongue diagnosis, and then they'll apply what they think is best. So these are what those interventions are. Now, many docs practitioners will, over the years of my teaching, they'll sort of protest the algorithm, this whole sort of flow chart, because they'll say that they handle IBS and symptoms that are similar to that with probiotic or other simple measures. And so they're like, we don't like this algorithm. But basically, that is excellent. That is the best case scenario. That's what we all wish would happen for us, right? That we could just do some simple measures. And that actually does work for many people. And what I would say is that this flow chart isn't needed for those people. They've been handled. So the algorithm is really, this flow chart is really third line therapy. It's for when the first and second line options haven't worked. And I just wanted to be sure to add that first and second line box into the algorithm up here at the top to indicate I was here. To indicate what we really should be doing and what most of us do. Now hold on a second here. And I just briefly want to share a little bit of a story here about this. Is that it was a tad irksome for me to hear so many practitioners, saying things like, "Oh, I just clear my IBS patients' symptoms, with probiotics and simple things." And like I said, that happens for lots of people, but it was irksome for me because it didn't happen for me. And I, from a very young age, obviously I've had the problem since I was 5. I had like one of the most perfect diets. I eliminated all food allergens, all these things. I tried like every digestive supplement that you can possibly think of. And I tried it like 4 or 5 times because I had like 40 years to do this in, right? And then I would try the next new brand of it. And then I would try a different dose of it. And I'm wondering if any of you can relate to this, right? And so I basically, what I would say is that all of those things, many of these things really helped me in many ways, but they didn't remove my gastrointestinal symptoms. So for people like us, if you can relate, and I see Shivan nodding her head.
Yes.
This flow chart is really like missing information. It's like the next step that none of the doctors when I was younger that I went to, they didn't know about. And it is so, so helpful. Now, for many SIBO patients, oh yes, go ahead, Shivan.
Sorry to interrupt. I just wanted to say something here. Dr. Siebecker and I had another discovery conversation the other day, and it was, I casually mentioned to her that when I was 14 going to 15, because you can get your driver's license in Florida when you're 15. And I remember I went to a nutritionist in Sarasota, Florida, where I lived, who was sort of like this hip happening thing at the time. And my mom was very hip and happening. And so she took me. And I remember that I didn't have my driver's license in the beginning when I went to him. And then I remember that I would be able to, she drove me. And then she went, and then I was able to drive myself. So I know it was when I was 14 and 15. I had digestive issues back then. And we went to this nutritionist. And before, like, there were nutritionists like there are now. And we did food combining.
Oh, yeah.
Right. So,
I've done that like 3 different times.
Right. So food combining is when you don't mix carbs and proteins. It is extremely difficult.
You have to eat fruit alone. It can't go with anything.
Right. So a lot of people have heard of this or not. It's called, what's it called? Like hygiene or something. There's a special name for it. Harvey Diamond was a big foodie who perpetuated this for a long time. And I'm not saying there's anything wrong with it. It's just wasn't right for me. However, what it was is very, very much based on your willpower. Like you really have to really want to do it or really have a big why, because it's extremely difficult, not to mention the social implications, because like you can't even have like a sandwich or anything. Anyway, the shame that I felt from failing to adhere to diets. And when my candida was raging and I was chemically like, everything in my body seemed to be like craving sugar and carbs, and I thought I was a terrible person because I could not control my appetite. This was just a committee in my head. How many people can relate to that kind of shame? So if I had known about this, right, back then, the emotional suffering that I would have been relieved by and from would have been a life changer, to say the least. So I just want to let you all know, if anyone's ever felt shame about not doing something right when it comes to this whole business, you're not alone. Good for you for making it this far. Continued hope. I'll be quiet. Go, Dr. Siebecker. I just wanted to have this moment with everyone to go like, we're with you.
Thank you, Shivan. Okay, now, as Shivan mentioned earlier on, I have a handout that relates to these first and second line therapies, relates the second line supplement therapies, because as SIBO patients, we can also use these second line therapies to help treat and reduce the symptoms that we have from SIBO, like symptomatic relief. So let me just show you what the handout looks like. I have to.
If you all stay until the end, you're getting the link to this handout, which is what Dr. Siebecker called gold. And it is.
It's called the Sibo Symptomatic Relief Suggestions handout. And so I basically have the supplements that help all of the common symptoms for SIBO. So bloating, pain, constipation, and here we have diarrhea, nausea, acid reflux, indigestion. So Shivan will link that for you or get that to you.
Until the end.
At the end. Let me come back to here. Okay. Okay, so as I mentioned back on the algorithm here, when these fail, if they're not doing the job well enough, we move on to testing. We're here, testing. Oh, I got to bring my little laser pointer up again. Here we go. So then we move on to testing. And so the way a SIBO is diagnosed is with a SIBO breath test. And I mentioned earlier, or maybe I didn't mention it. When we were looking at the symptoms, the problem with those list of symptoms for SIBO is that those same symptoms exist in many other diseases as well. And so what that means is we need a test to properly diagnose this condition, because when you have that set of symptoms, it looks like SIBO, but it also looks like a whole lot of other diseases as well. The symptoms of SIBO are medically technically called non-specific. They are not specific to SIBO. So we do have to move on to testing to properly diagnose the condition. And these are just my general recommendations for what tests I recommend. I like to recommend and use a 3-hour lactulose breath test. Maybe I will consider using fructose in the future. Shivan and I have some information for you about that coming up. Just watch your inboxes for some information on that. There's another test called the Trio Smart test that now it's about a year out. It tests hydrogen sulfide gas. There are 3 gases in SIBO and EMO: hydrogen, methane, and hydrogen sulfide. And the technology to test for hydrogen sulfide has only been available for 1 year, believe it or not. So that's a Trio Smart test. In the United States, lactulose is a prescription item. But if you are a patient or a practitioner who can't prescribe, you can still order your own lactulose breath test through Direct Labs. This is what a typical result looks like, a report for a breath test. This one is our standard one, so it's just showing hydrogen and methane gases. So they are here, hydrogen and methane. They're on a table, and then they're also graphed over time. Here's the time, and here's the time here. And this particular patient was positive for hydrogen and negative for methane. So here, she was positive at 65 and 78 for hydrogen. I interpret tests positive out to 120 minutes. Dr. Pimentel likes to use 90 minutes. I use 120 minutes. And she was actually negative for methane. She is a scleroderma or systemic sclerosis patient who has diarrhea and bloating and other symptoms as well. And Systemic sclerosis is an underlying cause of SIBO. What it is a progressive autoimmune disease that essentially scars the small intestine, causing stasis. It can't do its proper movement, and then that allows overgrowth of microbes. So I'm going to give you part 2 of this case a little later on. This is what the TrioSmart test results look like. That's testing all 3 gases. So we've got hydrogen, methane, and hydrogen sulfide. And then they have their graphs broken out by each gas over here. And this patient was positive for hydrogen here at 41 and 45, and positive for hydrogen sulfide. Hydrogen sulfide, the way TrioSmart does it is it only goes as high as 10. So this person was fairly maxed out, positive, and then they were negative for methane. Okay, now I just want to tell you the reason why we test. The reason for testing, just briefly, obviously it's to diagnose the condition. Treatment for any disease is dependent upon what disease you have, and what if what you have isn't SIBO, but it's something else? You need to know that because the treatment will be different. And the best example of this would be genetic or primary lactose malabsorption, which has the exact same symptoms of SIBO: constipation or diarrhea, bloating, pain, and flatulence. But the treatments are completely different for these 2 conditions. For SIBO, we're using antimicrobials like antibiotics, herbal antibiotics. For primary lactose malabsorption, we change the diet to remove lactose foods. No, don't eat any lactose containing foods. And sometimes we use lactase enzymes. Totally different. And we certainly would not want to give antibiotics to a person who actually has lactose malabsorption, primary lactose malabsorption. So we really need to know what we're dealing with to know what treatment is correct. The second reason is to know the gas severity and the gas type. And that's because treatment is based on the gases that are present and their severity. We have different protocols, different treatment protocols for each gas. Now, practically speaking, I know that many people begin their SIBO treatment journey without testing. And what I would say practically about this is that, okay, you can do that, but then if it doesn't go perfectly, and you're not better after whatever you just did, then go get a test and make sure, is it SIBO that you have? And just know that ultimately we can do a better job of treating SIBO with a test than without, like much, much better. And if you'd like to know more about testing, later in the webinar, Shivan will show you a way to get access to my lectures on SIBO testing, including how to interpret breath tests. Okay, back to the algorithm. Once you know you have SIBO, we move on to treatment. And the prokinetic afterwards to hold the gains that we made. So a prokinetic is a medicine that amplifies and coordinates gastrointestinal motility, and they can be prescription or natural. They're not laxatives. Laxatives' purpose is meant to loosen stool and produce a bowel movement. Prokinetics do not have that purpose or intention. They have a different function. And they can have different sites of action. So some of them focus on the upper gastrointestinal tract versus the lower. I find that this step is often skipped or overlooked, unfortunately. Many people just don't know about it. And I'm going to be discussing this along with this whole prevention section and relapse issues in webinar 3. Now, over here we have diet, and I've already explained how this is floating out on its own because we can use it at any point in the algorithm.
Wait, where was that? What were you talking about, Dr. Siebecker?
I was just circling it here.
Oh, the diet. Okay, great. Yep.
Yeah. So we can use it at any point, and
that controls symptoms, everybody. So that can make you feel better quite quickly, but it is not going to cure your SIBO. Just want to clarify that.
That is right.
If it did, I'm sure we'd all be clear. We'd be, when I started my SIBO diet, I would have been like, oh, it's done. Right. So remember, this is the whole picture, and you guys are doing great in the chat, but it's getting a little off topic. So come on back. You will get the recordings, but Dr. Siebecker is dropping gold left and right here. Okay. And she's doing it in the same tone, like detail, detail, gold. So really listen. Okay.
It is
Yeah,
really true,
everyone
you
is
guys.
so-
I mean, believe me.
This is what people like travel across the world to go hear.
Yeah.
Pre COVID, of course.
Well, yeah, I didn't actually mention that, but people traveled from all over the world to see us at the Sibo Center.
Yeah.
Okay, now on the topic of Sibo diets, there are a lot of diets that can be used for Sibo. And what all of them are doing are manipulating carbohydrates. That is what they're focusing on, because carbohydrates and reducing them and altering them, because that's what the microbes that are overgrown in SIBO and EMO turn into the excess gases. So I've listed 8 diets here. The top 4 were designed for SIBO specifically. The bottom 4 were not. And I want to start with the bottom diets. So underneath the big black line in the middle, we have the low FODMAP diet. That was designed for IBS generally, not necessarily SIBO, kind of like IBS in the large intestine, and IBD, inflammatory bowel disease. We have the specific carbohydrate diet that was designed for celiac and IBD. A variation of the specific carbohydrate diet is the gut and psychology, or GAPS diet, that was designed for those who have autism and brain disorders with the GI problems. And then we have various forms of paleo that often reduce carbohydrates, and these were designed for optimal health. Now, coming back up to the top, the SIBO specific food guide is a diet that I put together. It is a combination of the low FODMAP diet and the specific carbohydrate diet. And the reason that I put this together is because I was originally using the specific carbohydrate diet in my patients, and people who had IBD or celiac and were using that diet were having phenomenal results, like 95% symptomatic relief or something. And I wasn't seeing that in my patients. And so I wanted better results for my patients. I had read about all the studies on the FODMAP diet. I'd read about it. And it was clear to me that these 2 diets are actually kind of opposite each other. So I brought them together, these 2 sort of opposite diets. And then the success I was having with my patients, success meaning symptomatic relief, just skyrocketed. So it's very, very successful. Now, the next diet down for symptoms, the next diet down is the Sibo Biphasic diet. This was created by my friend, Dr. Narala Jacoby. She took my diet and put it into 2 phases, really 3, but it's the biphasic diet. It's very nice because it has those phases. Next, we have the Cedar Sinai fermentation diet. Dr. Pimentel created that. This is his version of a low residue diet that is used in a lot of hospitals and places like that. And he also designed it specifically for SIBO, but for the prevention phase, meaning he only wanted this diet, the way he conceives of it, to be used after you finish antibiotics or elemental diet, because those are the antimicrobials he had put in the flowchart. And then the fast track diet for IBS by Dr. Robillard is for IBS and SIBO and conditions that have excess gas. Now, this is the point that Shivan was saying earlier. Why do we use diet? The number one reason we use SIBO diets, or more aptly, what SIBO diets are best at, is symptomatic relief. This is especially useful for those who have ongoing chronic SIBO to help control ongoing symptoms. But there are drawbacks to SIBO diets. They can lead to severe restrictions. They can lead to someone putting more and more restrictions into their diet, and they can lead to fear of food. Now, food triggers the symptoms in SIBO, so the condition itself can cause people to be afraid of food, but the diets can really compound it as people go, oh, I can't have that, oh, I can't have that. So those are the drawbacks to diet. Of course, there's benefits too, right? Huge benefits, symptomatic relief. Now, I want to give you my recommendations on when to start a diet, because as I said, it could be used anywhere in the algorithm. So my general recommendation is to start after you've done the breath test, so as not to interfere with the results. Now, don't worry if you've already tested, if you've already done your test and you're on a SIBO diet. Wait, I'm saying that wrong. Don't worry if you're, yes, how am I saying that? I'm getting myself confused. basically, I don't want you to worry if you didn't do it right according to how this slide is. Just proceed, right? Just proceed. The next recommendation is you can start a diet based on your symptoms. So if you're having very bad symptoms and you really need and want fast symptomatic relief, then just start it right after the test, but before you've started your antimicrobial treatment, while you're waiting for your test results to come back, before you know what you're going to do for your treatment. So just start it right after the test. However, if your symptoms are really not that bad, then I would wait to start diet until after your antimicrobial treatment, because maybe then you won't need to be as restricted because you might have had a good treatment where the bacteria or archaea really were brought down. Now, one more recommendation that I have has to do with a common question many people ask about whether they should increase their carbohydrates while they're on antibiotics. And this is a strategy from Dr. Pimentel. He likes, when someone's going on antibiotics, to increase their carbs a little bit to make sure the bacteria are replicating, which allows the antibiotics to work very well on them. My recommendation is if you are already on a SIBO diet that is pretty restricted and you are needing to be on that sort of restricted diet to get symptom relief, like you have to adhere to that, that is not a good candidate to do this increase of carbohydrates. I have found that it doesn't clinically work well. So in this scenario, I don't recommend it. But then of course, after you've finished your antimicrobial treatment, you can try expanding your diet. And by the way, for those of you, so I'm moving on from diet now, and I know this is about one of the most topics people are the most interested in. So for those of you who would like to know more about diet, Shivan will show you a way to get access to my lectures on Sibo Diets later in the webinar. Okay, how's everyone doing?
Good. We're good. So what are we going to next after diet? Okay.
Now we are moving on to assessment right here. Okay, so we're more than halfway down talking through the specifics of this flowchart. So after treatment, we assess. Now over here on the left, hopefully you can see my cursor circling this. If you feel 90% symptom improvement, and by the way, 90% symptom improvement is judged by the patient, and it's usually with a practitioner helping them figure that out, because sometimes some symptoms are gone while others are still there, and it's kind of hard to pick an overall percent. One way or the other, you choose a percent. Now, many practitioners will shoot for 80% symptom relief, but I chose 90 because I found if I would do one more treatment round of the antimicrobials, and when someone felt 80% better, then we could usually get them to 90% better. So what I found is that 90% symptom relief was very attainable in many cases. And what I'm really talking about here are the chronic relapsing cases, of which a majority of cases unfortunately are. And I will discuss all of that in webinar 3. For these chronic relapsing SIBO cases, 100% symptom relief is not expected, but 90% is achievable, and that's pretty darn amazing. So prevention, this is where, yeah, go ahead, Shivan.
Dr. Siebecker, people are just commenting that you skipped over, quote unquote, the treatments, but guys, that is going to be covered in the second webinar that we're doing.
Yes, as I mentioned, I have an entire webinar, webinar 2, is covering all of this, I mean, in detail. Okay,
and that is this that's the next one that you signed up for, or if you haven't signed up for
webinar 2 in the series. Okay, right. And then prokinetics and this whole prevention block is webinar 3. So you're going to get an entire lecture on that. So yes, I did skip over it intentionally. Okay, now we're moving down to prevention, right? So prevention includes prokinetic, as it's listed there, and diet. Those are our 2 key things. And we also do the meal spacing, where we don't snack between meals. And we generally want to do this for about 3 months, because the most common time for people to relapse after they've gotten their test negative and they're feeling all better, at least at first, like right when they've first gotten their test better, is around 2.5 to 3 months. So what we want to do is we want to just give a little extra help with this, diet and prokinetics for about 3 months to get someone through that time period, that sort of sensitive time period when we might see a relapse, when it's common for that. And I'll discuss that more in webinar 3. Now, coming back up here, when a patient is 90% better, you don't need to retest again. I don't think it's necessary because you've achieved the goal, you're better. Sometimes we retest, but it's not necessary. And I want to show you part 2 of the case that I showed you earlier, to show you, because we're going to start talking about when we would retest and why we would retest. So this is what a retest looks like. So here we saw that the hydrogen, by the way, what makes a positive hydrogen is 20 within the first 2 hours. And what makes a positive methane is 10 within the first 3 hours, all 3 hours. So this person was positive here at 60, 65 and 78. Then I gave them a treatment of berberine complex. That's an herbal antibiotic we use. And take a look down here. It's all 3s and 4s. And even these high numbers here in the large intestine, all of this it's now negative, and the methane is at 0. This was an extremely successful result. The hydrogen was lowered by about 70 parts per million in the small intestine. I will say that that is not normal, but I wanted to show you a real case I had about some of the wonderful possibilities that can happen. Her symptoms were 90% better. This is the patient who has that ongoing autoimmune disease underlying cause, which is systemic sclerosis. And she was 90% better. Her diarrhea, all her symptoms went away, except she still had a little diarrhea, which you really can't fully get rid of with scleroderma. What was that diarrhea? She had now formed stool 3 times a day. I mean, some people wouldn't even consider that diarrhea. So phenomenal result. That's kind of what I mean by 90%. Okay, now let's go over here on the right to this partial improvement. What if you go through this treatment? You find out you've SIBO, you treat, you're on a prokinetic to hold the gains, but you're not feeling 90% better. You're less than 90% better. This is the circumstance to retest. This is this yellow box here, retest. I'll explain why we would do that. But first, I want to explain the timeline of that's written there, within 2 weeks. So it's best to test within 2 weeks of finishing your antimicrobial treatment. So what this means is day 1 to 13 after stopping your antibiotics, herbal antibiotics, or elemental diet. And the reason why is because it's very common for people to relapse, or more correctly, we would say backslide, at 2 weeks after they finish their antimicrobials, in the circumstance when the SIBO is not yet actually really gone, and we know we're going to need more treatment rounds. This depends on how high someone's gas is. If their gas is high, we're going to need to do multiple treatment rounds. But the point here is don't wait too long to retest, because we want to see the effect of what the treatment just did. We want to see, what did our treatment just do? We don't want you now backsliding backwards. We want to see it in that 2-week period. This is a question, I mentioned this here because this is a question everybody asks about this 2 weeks.
It is so important, and so many practitioners, you will need to guide with that information. And by the way, if there are any practitioners here, hello, we love you. Thank you for being here. Kudos to you for getting this training. And don't forget that Dr. Siebecker has a 2-part training for pros next week. One is a beautiful presentation with hot topics like this. And then one is a Q&A session. So yeah, we have a 22,000 person Facebook group called Sibo Sos Community. And this is where not only do I see fellow patients get this part wrong about the retesting, they're often, I'll say, their practitioners are not doing that part. They just don't know. They just don't know. Yes, nothing, I'm not mad at them. That's why we're doing this, is to help as many people as possible. They just don't know.
And they don't have, I've spent the last 11 years only treating SIBO patients, and that is not how many other practitioners are. How would they know? Okay, now why are we retesting? First of all, to see if the treatment worked, or how well, if symptoms are still present. Did it work? Didn't it work? Is SIBO gone? Is the gas reduced? or is it worse? We want to evaluate things when it's not correct. We want to use the testing when we still have symptoms. The next is to guide our next treatment course, because if the last treatment protocol didn't work well, we'll see that, and then we know we need to try something different. And sometimes we need to try something very different. And then next is to encourage the patient when there's cases of high gas, because we can see the gas lowering, like I just showed you on that retest, even if symptoms aren't yet relieved. So it can take 2 or 3 treatment rounds, depending upon how high the gas is, before we really start seeing symptoms improve. So that's something very important for you to know, is don't expect to have all your symptoms relieved the very first treatment you do if you have higher gas and we need to do multiple rounds. But when you do a retest, if you're in that situation, when you see that gas come down, even if your symptoms haven't gotten better, it is just incredible for the attitude, for the mood. It gives hope. It lets you know you're on the right path. And lastly, and probably most importantly, we need to assess the diagnosis of SIBO when symptoms are still present, because the retest may be negative, yet the patient still has symptoms, and this would mean those symptoms are caused by something else. So newsflash, this was always the biggest thing that I remember being said in medical school. People can have more than one thing wrong with them at the same time, and they often do. It's pretty common. It's pretty common. So don't assume SIBO is still there if the symptoms are still there. Now, practically speaking, I know many won't retest after every treatment the way that I do it with my patients, but at least retest after 2 treatments, at most 3 treatments, because your SIBO might be gone and you're barking up the wrong tree.
Because you may have symptoms of a parasite or candida. Is that what you're saying?
And I'm going to show you that in one second. So this is the area that I am just talking about right now. Your symptoms are still there. You're not feeling better. You've done you want to do a retest because it might be negative. And that means you have another diagnosis going on. So what would that other diagnosis be? Here you go. Little overwhelming and daunting, right? This is what's called a differential diagnosis list. It's really just a list of other diseases that have similar symptoms. It's a list of what else it could be if it's not SIBO. And it's a really big list, okay? So that's why we do that. Now, let's say you've retested, but your test is still positive. That is very, very common. It just means you need to continue with multiple rounds of treatments. You need to retreat. So we're going to follow this big purple arrow all the way up around the right-hand side and back into here, where we're going to do our 3 main antimicrobial treatments.
Dr. Siebecker, can I just point something out there, is that it might still be positive, but you still have made progress. There are 2 things, because
that's partial improvement.
Partial improvement. Okay.
Partial improvement. I mean, because that's what happens. It takes multiple rounds for most people to get their test negative. And so, maybe first treatment, nothing much changes. Second treatment, symptoms start to come down. Third treatment, all the way gone. Something like that. That's how it typically goes. Anything else you want to add, Shivan, there?
I guess we're used to taking treatments, whether it's antimicrobial or antibiotics, particularly an antibiotic. You have a UTI, and heaven forbid, and you take the whatever, amoxicillin or whatever they give you. I'm not a doctor, but I can't even remember what it is. But and then you're better, thank God, right? So this is different. This was a huge learning for me, because when I first had my first round of rifaximin, I was so excited. I was like, the angels sang, this is it. After all this time, in 2 weeks, I'm going to be well. And I was personally devastated by the fact that I was not transformed in 14 days. And so I didn't understand what we're teaching you right now, which is it's gas levels that come down.
And we're doing this circle. We're doing this circle.
Exactly. Now, sometimes people do experience gas levels that go up after a treatment, which is very confusing. And that will be the first question I ask when we get to the Q&As.
Perfect. Okay. So this means I've brought you through in detail the whole algorithm, except for the parts that's webinar 2 and webinar 3, except for this. So here we are down on the bottom left with the red boxes of relapse. So if a relapse occurs, meaning you got your test negative, you're all better, but then it comes back after some amount of time. What you do are two things. You just treat it again. That's this purple arrow coming here to the retreat box. And that brings you up around here. So, the symptoms come back, the overgrowth has grown again, you treat it again. And the other thing you need to do is try to figure out what's causing the SIBO. Because if you can identify and treat and hopefully eliminate the underlying cause, then you can eliminate the SIBO relapses. And I will discuss that more in webinar 3. So now I want to wrap up with some key treatment points. Now, these key treatment points are the types of things that I and my colleagues learned over years of treating SIBO patients. They are our gold, okay? First is use a methodical approach. Following the algorithm is a methodical approach. I understand there are lots of issues making it difficult to follow every step in that algorithm, such as expense, timing, commitment, right? You can always try treating SIBO without a methodical approach at first, as I said before, because maybe it'll be a really easy case and one treatment will be successful. But once that isn't the case, once you start having trouble with treatment or you need more treatment rounds, a methodical approach is the most successful. I just can hardly express how much time it saves for you going through your whole treatment SIBO journey. It saves so much time and thus money. You think it's not going to because I don't want to pay for a retest. It actually saves money over time. I see Shivan nodding like crazy. We've both experienced this.
Big time, big time. I wish I had this prior to meeting you. And this is why I asked you to continue to build the trainings that you and I share with people, because this is what I wish I had had when I first got diagnosed or first even heard of SIBO. It's a waste of life, and I don't want that to happen to anyone else. Anyway.
Okay, so it basically, when you're methodical, it just takes you out of guessing. The guessing is the worst. That's what wastes all your time. Now, you don't have to follow these key treatment points. You don't have to follow my advice, all right? What this is about, these key treatment points, it's about increasing success. It's what I and my colleagues have learned from our experiences and failures of how to be the most successful with SIBO treatment. And this is probably the most important point of all. And what this point also means, using a methodical approach, is continuing to treat until the SIBO's gone and not giving up after just doing 2 treatments, which is the thing I hear all the time. Next point is to test. I've already explained why. Don't skip that. Next point is to know. This is what Shivan was just talking about. Successive treatment rounds are often needed, especially when you're using antibiotics and herbal antibiotics. So something I haven't mentioned yet that is maybe some of the biggest gold of all, and I usually have a gold bar slide for this, but I don't today. 1 treatment round of antibiotics and herbal antibiotics lowers gas, meaning hydrogen and methane, by about 30 parts per million on average. Now, it can be more, like that wonderful case, that before and after case tests I showed you where it was 70 parts per million. Usually it's around 30. Comparatively, 1 round of elemental diet lowers gas by about 70 parts per million. However, people who have severely high gas may still need more treatment rounds after even doing elemental diet. So this is why we need multiple treatment rounds, because 1 round doesn't do the whole job depending upon how high the gas is. The point of this is not to give up after 1 or 2 rounds. It's normal to need 3 to 5 treatment rounds, even 6 to get a negative test. That's normal for many cases. That is what I have named time and fine. That's compared to 1 and done. 1 and done are the wonderful, lucky people who they take 1 SIBO treatment and it's all gone. Kind of like the person who's before and after test I showed you, except remember, she is always going to have chronic SIBO because she has an incurable condition that always causes it, right? But this is important. Don't give up after 1 or 2 treatments. Next is retest to assess results. Many people think they have chronic SIBO that can't be gotten rid of, but they've never had a retest to show Is their SIBO actually gone? Maybe those symptoms they're experiencing are due to something else. Or what if the gas was lowering with whatever treatments they did, the few treatments they did, and they were on the right track, but they never knew that because they didn't do a retest. Prevention of relapse is a key part of SIBO treatment, and this is one of the most skipped steps that really makes a difference when followed. Webinar 3 for more on that. And this is my last key treatment point I want to mention. Timely follow-up matters to avoid the loss of the gains made. This is a really hard one for people. When you're trying to get a test negative for the first time, while you're in the process of the multiple rounds, the time and fine, timely follow-up can really matter. You can lose improvements and backslide if the next treatment isn't continued fairly soon. And ideally, that would be at about 2 weeks. In comparison, once you've gotten a test negative, so let's say you've been successful, you got your test negative. If you then relapse, it's almost never back to square one. Once you've made that initial improvement, you're in a much better state. But during the initial process, when you're first trying to get the test negative, that's when timing really matters. You can lose ground. So here's an example. It's like if you were given 10 days of antibiotics for a sinus infection, and you stopped taking them at day 5 because you now started to feel better. You were feeling better. But then you relapsed because you didn't finish killing it, right? You really still had the infection. You just didn't finish your treatment. You stopped prematurely. And then let's say you restarted your treatment a month later, you really never got rid of it in the first place. And now it's almost like you're starting over. So this is the concept I want to give to you about doing these multiple rounds. It's really all one treatment course. You don't want to leave too long. So I want to say that I really understand in our busy lives, this kind of timely follow through can be very hard. And also with the practitioners you're working with, I'm just sharing that it really, truly makes a difference and really increases success. Okay, now I'm done. I'm going to summarize or just give you some closing thoughts. I have found that this flowchart vastly increases success compared to when we don't use it, because I know the difference. It's been validated with studies and thousands of patients in multiple clinics. So just try to keep it in your mind as you approach your SIBO and just follow it as best as you can. It will help you as much as you follow it. And here it is. You can take a beautiful look at it again. And that concludes my lecture portion.
Okay, thank you, Dr. Siebecker. Would you do me a favor and leave that up on the screen?
Sure.
And I want to say thank you and just applaud you for your persistence in making sure the world gets through this. All right, Lena saying congratulations. And yes, you will get a copy of this at the end for staying through the end. I also have another surprise for you if you will stay through the end, everybody. And by the way, you will get a recording of this. And you also, we're going to be getting to the best, not the best part, but the additional part, which is the Q&A section, which Dr. Siebecker is phenomenal at. So here's the thing. I want to just ask you all to sort of shake it out. Woo, shake it out. Yoga teacher Shivan, here I am, here I am, here I am. Okay. So I had Shivan's yoga studio for 10 years in Sarasota, Florida. So that's where I was talking about that. And I'm thinking about doing a yoga series on YouTube, like yoga for digestion or whatever. Anyway, I want you to look at this chart and I want you to ask yourself, where are you now? So chances are, if you're here, you're either like seriously, really thinking you're SIBO suspected, or you've maybe done a breath test, right? We didn't even define what SIBO was in the beginning, I realized, because we know that by the time people make it to a SIBO training, you guys already know that it's small intestine bacterial overgrowth. It is intestinal methanogen overgrowth. We'll explain that terminology. We have to do that, by the way, Dr. Siebecker, that nuance. And
I'm going to talk about that for like 10 minutes in webinar 2.
Okay, good. Thank you. And that, you're probably frustrated, right? We had thousands of people sign up for this today, by the way, and for this series. So we're very, very happy that you all are here. And we know it's just the drop in the bucket of what we need to continue to do. But the thing is, I want you to look at this chart. I want you to look at this algorithm. We call it the SIBO Recovery Roadmap. And I want to see where you are. Where are you? What do you feel would be a next best step for you based on what you know so far? And we know we haven't had the whole thorough understanding of the whole thing because it's not all been explained there. But do you need to reevaluate your treatment? Do you need to do a retest? We'll just type in there. Yeah, just pop in some comments here because I'm fascinated. Okay, retest since you think you relapsed. Do you need to explore prokinetics? Do you need to like tighten up the diet because you think you're getting somewhat better, but your symptoms are still tricky? Newly diagnosed, welcome, got it. Yeah, retest, a lot of retesting. Ooh, and retreat. Retreat, when I hear people say it, and even when I say it myself, I feel like run away, retreat. That's not what we mean. We mean move forward to retreat the condition. Yeah. Okay. Another treatment round is another way of saying that. Got it. Right. It's very easy to get discouraged. And, it's also very easy to get better. So I just want to talk about that for a second, that don't let this get you down. I know it's easy to say. You're here, you're taking action. I couldn't be more fellow citizen proud of you all for being here. So thank you. Okay. Yeah, you guys you've been through it. Let's face it. That's why we're all here, right? So I just want you to take a moment, take a look. You'll get this at the end. And I also want you to know that if you stay until the end, which will be worth it, you're going to get Dr. Siebecker's favorite chocolate cake recipe, which is delicious. And that is the cake recipe that I had for my birthday cake the past 2 years. So she likes a good cake. So please stick around because we have some fun stuff for you. So now take another breath with me and just imagine, go back in time, however long, or imagine your future. I know a lot of you can remember what it was like pre-SIBO, right? And then a lot of you cannot even remember what life was like before without it. So maybe you have to shoot forward into this imaginary future and imagine what it would be like to be able to go to the beach and not feel like you had to wear a caftan. I'll speak for myself. What would you love to do SIBO free? What would be like Christmas and the holidays, not worrying about the diet and the symptoms, the vacations, the romantic life of not being, no one talks about that, how it can really impact your romance. Let's face it, it's hard to feel sexy time when you're feeling bloated and constipated. Moving on. So you missed that part, Allison, but I know you got it. So what would be your, eat without pain, pizza, a lot of pizza. I feel you. Eating out, no gas, no belly pain. So, right, feel free. It's almost as if you would actually just have to practice being in the moment and being appreciative for what you have, because it's like pain, right? When the pain, or it's like I got the flu a long time ago. And I remember thinking, oh, how I regret not treasuring the time without the flu, because you think it's never going to go away. So this is right. So it's almost as if where it's not even on your radar that would be the result we're all looking for. It just wear your bra again. Amen. You're just so in the moment. Nothing's getting you down. I remember when I used to do the overnights at HSN, it was a very difficult time. I had a 1-hour commute each way, would get up, put on full-blown makeup, go do TV after an hour drive, do TV's done, get back in my car, so lonely, drive back home. And I used to it was a very miserable time for me, even though I loved my job. It was a tough gig. And to say that it was very competitive is an understatement. And I have notes that I have written to my sisters and my friends and families. And some of them have come back to me. And I saw a PS in one of the letters that I wrote. And it was, PS, please continue to pray for my schedule. Because I could not get it off my mind. I was like, if you have energy available, put out some good thoughts for me. I mean, this was like a song in the background of my life. And it wasn't a good one. That's the way this is as well. And I know you can relate to that. So it's, instead of having that in the background, I want you to hear symphonies or, Rod Stewart or whatever turns you on. I want that to be the music that you hear in the back of your mind, or that it's, beautiful chirping birds or silence, whatever it is. So this is our wish for you. We are so committed to it. I can't even tell you the behind the scenes commitment that Dr. Siebecker and I pretty much I wrote in the thing when I said to everybody, you know, Sibo SOS is going on vacation for 2 weeks at the holidays, because to say that I think about this 24/7 for you all is not an understatement. Like, our team is practically 24/7. So I want you to know that is our devotion to you, and we are with you. So I want you to really sort of wrap yourself up in this feeling of it's possible. At the very least, with a chronic condition like small intestine bacterial overgrowth for a lot of us, right? You can feel 100% better with a managed condition than leaving a chronic condition untreated. And this was a big wake-up call for my brain, because I wanted to have nothing wrong with me. Like when I was 18, even though I did have it then too, I wanted it to be like evaporated from my existence. But for me, because I had the food poisoning, I have the antibodies, that's not happening right now. So I manage it, and I feel I feel 100% better than I did. Oh my gosh. Even though I've been exposed to mold for 20 years, even though I have old Lyme, blah, blah, blah. So I just want you to know that there are answers. This is what we've been talking about. And we have some solutions for you. This is where the hope comes in, full steam ahead, everybody. This is just so exciting. I even have a visual. I was very, inspired. And where's my little cute visual? Let me find it for you. Wait for it. Let me share my screen. Okay. First of all, stay until the end, because we're going to get you some cake. Allison, I added the cake recipe for everybody who stays until the end. Let me share my screen. So there's something I personally really want in my life, and I know that may sound weird to somebody, but I really, really want to swing. Does anyone have a swing in this place? Anybody here have a swing? I remember being little, right, in New York City, going to the park, and I would swing. And it would make me so happy. And then there's studies, Allison, Dr. Siebecker, that show how it impacts your endorphins and your central nervous system to swing. I'm like, that's cool. That's me swinging. So I want you guys to get a happy place picture and put it up and look at it. So, know that the solution, live near a park, tree swing, cake. Britt is like, wait, cake? Dr. Siebecker is an amazing cake recipe. Okay, yeah, I didn't know about it when I first met her either too. So that's why I want to share it with everyone. So take a breath. There is hope. You have answers. Yes, they are here for you. So you will be getting the algorithm. You will be getting the symptomatic relief information. So please hang in there. And wait until the end. I know we've been here at it for a while, but we're about to take off with steam, because she's going to start answering some questions in the middle in a minute. But imagine getting that negative breath test. Imagine being able to button those pants, no problem. Imagine, being able to wear, for me, a tucked in shirt and belt. I'm not a fat girl, but I definitely cannot tuck my shirt in and wear a belt. And do you know how stressful that is for a girl who sells clothes on TV? But that is like, it's coming. It's so much better than it was. Like, no one thinks I'm pregnant anymore. So, that is just huge. So I hope you pinpointed where you were on that. I hope you will have visualized what life could be like on the other side of all of this, because there is hope. And I know that you can experience it. At the very least, vast improvements. At the very least, the reduction of stress of not knowing what to do next. That is so huge. Now, Dr. Siebecker and I created something. I asked Dr. Siebecker to do something, basically. And I said to her, Dr. Siebecker, would you please create a course for us so that we can share this information with everybody, this algorithm and how to go through it? And Dr. Siebecker came to Florida, and she and I created the SIBO Recovery Roadmap Course. Now, you don't have to do it, but if you want to, I want to tell you about it, and then we'll get to Q&A shortly thereafter. Thank you so much, Dr. Siebecker, for doing this. You can look at that algorithm, guys and gals, and it's like you can look at a car, right? I get it. There's windows. Yep. Okay. They're going to retest. Okay. There's a steering wheel. Got it. There's a roof. There's a gas tank. But you won't necessarily know how to drive, right? You need to learn how to use that algorithm. And that is exactly what Dr. Siebecker has put into the SIBO Recovery Roadmap Course. If you're a pro, she has a practitioner course, which I hope you know about. You can email us at info@sibosos.com, and she has 2 trainings on that next week. So the magic is the algorithm, knowing how to use it. And we are going to get you some very special bonuses if you want to come and do it with us. Again, you don't have to. I'm just saying, if you're into it, that would be awesome. We would love to have you. And Dr. Siebecker hasn't usually included as many Q&As as we are about to do for you in 2022 if you order in January. So I just want to show that to you. It'll only take a minute, and then we'll get to the Q&A. Okay, so let me make sure I hit the right thing, and hold on for a second. This is where you're empowered. You're able to talk to your doctors. This is what I wish I had had. This is what I didn't do it nearly as well. But Dr. Siebecker, this is the whole thing put together with support. Hold on. Okay, here we go. Here we go. So boom, share screen. Let me just show this to you. There it is. I have to cut off one of the pictures, but this is what you get. So you are getting 8 live Q&A sessions with Dr. Siebecker and me to get your questions answered in 2022. So previously we have done this, and we did maybe 1 or 2 Q&As last year. I don't even know if we did that. Did we do that many, Dr. Siebecker, last year?
No.
Yeah. Dr. Siebecker's been working on her book, and I call that in deep cabin mode. So like a cabin in the woods writing a book. And so I didn't talk to her for 6 months. I didn't talk to her for like months at a time, and we usually talk every day. So I'm very excited about 2022 because we are offering 8 live Q&As over the next year. Now, also, this is very important to both of us. The information's changing, right? And that's so exciting. The updates are included in this course. So if Dr. Pimentel comes up with a cure for a drug to help people with SIBO, you're going to find out about it because it's going to be in the course. Recently, we had a conversation with someone who had a breakthrough in their clinical research on another variation on a test that he really saw some significant results with doing some of the breath testing in a very specific way. That's going in there. Hydrogen sulfide testing came up, as well as a hydrogen sulfide treatment program that Dr. Siebecker has created. That's in there. So this is getting updated all the time with relevant information, and we're very proud of that. Again, for those Q&As, you can pre-submit your questions. If you did want to buy it, it is now and enroll. It's now $201 off. It's $298. We have a payment program. You do get it all right away. I don't like it when I have to wait for a course because my motivation ebbs and flows. So if I'm interested in doing something and have a weekend off or a couple hours, I want to be able to get to the material I want right away, especially because in the algorithm, you want to see, okay, I have a testing appointment in 2 days. How do you do that prep diet again? You're going to be able to quickly access it all. So there are also searchable professional transcripts. They're freaking gold. And you get the SIBO Essentials, the 8 lessons. If you're brand new, newly diagnosed, that's a great place to start. That's included. We used to have that on its own. I guess you could still get it on its own, but we wanted to include it. And then the private Facebook group. So that is 22,000 people strong. You don't have to do that, okay? You can if you want to, but you don't have to, because I know some people are like, I don't like Facebook. That's fine. So I just wanted to show that to you. This was Dr. Siebecker and I in my dining room in Florida of one of the trips that she came. She's come multiple times, and this is the biggest and best we've done. Seriously, we've never done something with such a blowout before. So I wanted to show you that and invite you in. If that appeals to you, we would love to have you participate. Now, for the first, I have to calm down. I have to ask you a question, and then I'm going to announce something. It's very exciting. Are you ready, Dr. Siebecker?
Yeah.
Okay. So that was the pitch, everybody. There it is. If you want to join us, great. If you don't, that's fine. Question, but we do have some great bonuses that no one knows about. All right, Dr. Siebecker, what if I take a test and, what if I take a treatment round I take a test like I'm following my algorithm and my gases go up? What is that? What could that mean?
Yeah, so this is to be expected when a person has positive methane gas, and then whether they have it with hydrogen or not, because the way it works is that hydrogen gas is converted into methane gas or hydrogen sulfide gas. And so if you have either of those gases and you treat them, and then the bacteria or archaea that make those hydrogen sulfide or methane gas comes down, you will then see the hydrogen gas go up, because now there's more of that. It's not being converted into the methane and hydrogen sulfide. So this is something we actually expect to see. We don't always see it because sometimes the treatment also reduces the hydrogen producing bacteria at the same time, but very often treatments tend to reduce the methanogens or the bugs that are producing hydrogen sulfide. And so those come down and then the hydrogen goes up. Now, if by chance your methane goes up, maybe you didn't have methane before, or maybe you did have methane and it goes up. This is a different scenario. This is when, hold on a second. This is when what we call lovingly pissed off bacteria syndrome or pissed off methanogen syndrome. Sometimes when you're in the middle of treating the overgrowth, and you do a retest, you see this increase of the very same gas you were trying to reduce, and it goes up. And what we have found is that is just sort of catching a snapshot in the middle of the process. And it's as if we rile them up and they're all mad because we're trying to kill them. And then they somehow just raise up their gas, maybe like they release gas as they're dying. I don't know exactly. But if you just continue with your treatment, continue on in treatment, almost always the next retest will show the gas has come down. And actually, Dr. Rezai had the same thought, and Dr. Rezai works with Dr. Pimentel, and he runs the research lab at Cedar's there with Dr. Pimentel, or the research department. And he actually did a little in-office study on this and reported in one of our Sibo symposiums or conferences that this is what he saw also. So he actually formally did a bunch of these tests. And so you just basically try not to worry too much about it. Just continue with treatment. The only thing I'd worry about is if it happens twice, like in a row, then you're having something tricky go on potentially. But usually you just continue treating. And like I said, if methane or hydrogen sulfide has come down and hydrogen has come up, that's normal. We expect that. And then you just do another treatment, and then you'll see the hydrogen come down.
Okay. Thank you for that. That is a common question that's very, very frustrating. So Clarissa, who's behind the scenes with us today, is going to, can you please do me a favor and post again how everybody can get in on the course? Thank you very much. It's $201 off. You're also getting some cooking classes, and you're also getting those 8 Q&As, which I just cannot tell you enough how they're life changers. No one can go see Dr. Siebecker right now as a patient. She is truly working on her book. And so this is the way to get that direct access. And it's a huge, huge opportunity. Okay, here we go into some questions for you, Dr. Siebecker. The questions, by the way, are brilliant. You guys are so smart. So Dr. Siebecker, can you please talk about the fear about antibiotics and rifaximin, which is the #1 pharmaceutical, Dr. Siebecker will speak to it, about, I don't like antibiotics. Believe me, I felt the same way. The first time I even heard of this, my girlfriend, it's in the book, talked about how she was on a really weird antibiotic and blew into these test tubes. Then I was like, oh, well, that's not for me. I hate antibiotics, except of course, if you're saving my life, thank you, God. So talk to us about the multiple rounds and how rifaximin is different, et cetera, if you would, please.
Is the main question people are afraid to take antibiotics? What is the question?
It's a combination. I'm consolidating several questions. I'm scared of antibiotics. How is rifaximin going to give me systemic nuclear bomb in my microbiome? And what, you've already said it, by the way, I just want you to repeat it if you would. What can I expect each round within reason typically of a treatment? Like what would be ideal?
So I'll just start with that one because we already discussed it. But for antibiotics and herbal antibiotics, we expect to lower gas about 30 parts per million on average. That's for hydrogen and methane. Hydrogen sulfide, it's all new to us. You know, the testing's only been available for a year, and we're only seeing that level as high as 10 coming back on our test reports. So we don't know yet what to expect for that. But for the other ones, hydrogen and methane, 30 parts per million from pharmaceutical or herbal antibiotics on average. It can be more, and we love it when that happens, but that's what you should expect. For elemental diet, 70 parts per million for treatment round. A treatment round for pharmaceutical antibiotics and elemental diet is typically 2 weeks. For herbal antibiotics, it's typically 4 weeks. And so that's that question. Now, for concerns about antibiotics, rifaximin is a very different antibiotic than other antibiotics. It's actually called a eubiotic, which means it has positive properties, and it really does. It does not destroy the microbiome that's in the large intestine. There have been multiple studies on this. It actually increases bifidus, lactobacillus, and there was just another study on another bacteria increases. I probably have it on my desk here. I don't have it memorized yet because it's so new. So it actually benefits the microbiome in the large intestine. This is why it's called a eubiotic instead of an antibiotic. It has positive effects as well. It's really just very, very different than your standard antibiotic. It also does not cause yeast overgrowth. It does all these amazing things. It can actually make it so if you take it with other antibiotics that people can become resistant to, it can prevent that from happening. It is very special. So rifaximin, I personally feel there's no need for any fear or concern, with that. I mean, people have fears about everything that's to them, but on paper, that it's a very different thing. Now, as coming up with the idea of the other antibiotics, rifaximin, we haven't, webinar 2 is all about the treatments, where you're going to hear me talk all about these antibiotics. So the other antibiotics we use are neomycin or metronidazole. And, many people are afraid of taking these. But what I would say is that we have studies to show that using the antibiotics that we use for SIBO, the very ones we do and in the combinations we do, really works. And that has borne out in my experience. They're life-giving. You know what I mean? That's what antibiotics are supposed to be. They've been used, overused and misused, and they can cause all kinds of problems the way that we've been overusing and misusing them. But this is an appropriate situation for a very good cause. So, if you don't want to take them, I understand. There are other options, which is wonderful. We have herbal antibiotics and elemental diet. The problem is that sometimes only one of those 3 methods will work on a given person. And sometimes we run out of options and we do need to go to them, but you'll cross that bridge when you come to it if you are really not wanting to use them.
So the next question is, and Jennifer's asking this, she's done some rounds. Can she combine the herbals with the antibiotics? What do you say to people who look at that chart? And we'll get more into this. So this is the last thing I'm going to ask you about treatments right now. But I've had a lot of people say, should I do antimicrobials that I can get at the health food store while I'm doing the elemental diet, for example? And if you don't know what those are, come to the next training. But what about that, Dr. Siebecker?
Yes, you absolutely can combine pharmaceutical and herbal antibiotics. And in fact, that's something we do with hydrogen sulfide. But you don't want to do antibiotics or herbal antibiotics while you're doing elemental diet. Elemental diet is a different type of treatment altogether. Okay. So, yeah.
So I want to let everybody know that the first 2 people who come in right now for this, actually, I just had one, Patricia, you're in. So one more person will actually, who just comes in right now for the course, would get 15-minute consultation with Dr. Siebecker. So if you are interested in that, I definitely want to see if you can come on in for that. We would love to. It's just the next person. But after that, I have some other goodies for you. So I'm just trying to give you a little kick in the booty to get you motivated. Dr. Siebecker, as I said, is not seeing people right now. 15 minutes. I know you can get a lot done in that time. That's just for the next person. And we're going to move on. Okay. What's the best way to treat SIBO? So that's tomorrow, that's Wednesday. I'm going to grab some of these treatment questions or whatever day we're doing it for the next training. And because it's very treatment heavy there. Do you see a nausea and vomiting as part of the SIBO cascade?
Nausea, yes. Vomiting, no. The way that I've typically seen vomiting in SIBO patients is when there's an underlying cause that causes their SIBO that also has vomiting. For instance, like endometriosis. Endometriosis is a condition where the uterine lining is swelling and growing, and usually outside of the uterus and other areas, endometrial lining, and it can cause a lot of pain. And that swelling and pain often leads to vomiting in people with this condition. Okay. So that SIBO itself, vomiting is not a typical symptom. It usually is from the underlying cause or something else.
Okay, thank you.
Nausea is very common, actually.
Very common. Okay, and Carol, you also get 15 minutes with Dr. Allison Siebecker. Thank you so much. You're getting us going here. All right, let's talk about, okay, we've got this. Most of your questions are answered in the course, but we're answering them here too, guys. One thing about rifaximin, again, because there's so many questions about this, it's not always expensive. You have coupons that you can get from the company, and then some insurance, and there are other resources and ways to get it. So that's going to be part of what we talk about next session. How about coughs, Dr. Siebecker? Have you ever heard of coughs being part of the SIBO cascade?
Cough is not a symptom of SIBO in and of itself, but acid reflux is. And sometimes acid reflux does lead to a cough. Sometimes acid reflux or gastroesophageal reflux disease, GERD, that is one of the symptoms why you know you have acid reflux is from coughing. So that would be the way, is that if you're having GERD is its own separate condition, but SIBO can cause that condition. So SIBO can cause conditions. So it can cause GERD, and then cough would be a symptom of that. So it is possible.
Jana is asking about the elemental diet. She has been on it. You know what? This is still treatment, but I'm sorry, I'm going to skip over it, but I can't start her and then stop her. But Dr. Siebecker, if you don't see progress with an elemental diet on day 15 and you retested, so you know you haven't seen the progress with the gas drop, do you stay on it for a couple more days?
So there's two things here. One, it would be a bit unusual to have no gas reduction at all. And so just as a practitioner, I might consider, I'm not sure if I would continue. It would kind of depend on that exact individual and the situation and knowing their history and everything. But it does happen sometimes. So the typical protocol is that Dr. Pimentel created for elemental diet is you do continue for one more week, a third week, if your test isn't yet negative. It's just that in his study and experience, most people were coming down in gas, but it wasn't normalized yet. It wasn't eradicated yet. So you then continue for a third week to continue the process. Something that can happen for some people is that they don't like doing it, the elemental diet, and they're not willing. They don't want to continue for a third week. So in that case, then you just stop it and you switch to a pharmaceutical or herbal antibiotic. But I would say if you're okay with doing a third week, then yes.
Okay. Let's talk about, let's see, I want to get a varied group of questions answered. My last SIBO breath test was 8 years ago. How often do you need to get retested? She covered that. So I'm going to, because that was early in the conversation. So I'm going to know that you guys already know that. Let's see, a lot of treatment questions here. Okay, come on now. Anitra says that her doctor says that the testing isn't reliable. You want to?
Oh yeah. So yeah. This has been the party line forever, and it's understandable where it comes from, because early on, test interpretation wasn't standardized at all. Every study that would come out would be using a different methodology to do the test, and so there was a lot of inconsistency. And early on, it gave this awful impression. I'm talking like 15 years ago. Well, Dr. Pimentel in research has been fighting against this, because clinically it is clear as day that this test is reliable. I mean, thousands of tests now. is so reliable and helpful. It guides our treatment. So he's like, oh my God, we've got to overcome this early prejudice that got out there. And part of the problem was that early studies were showing that it didn't compare well to culture studies. So culture studies is when they put a tube down in and they sample some of the small intestine fluid, and then they see if they can grow the bacteria and see how many there are. That would be considered the gold standard. But the problem is that test is not good. It's not a gold standard. So what Dr. Pimentel did was he worked on fixing the problems with the gold standard test, and he figured out all these changes to do with the culture test. And then he compared that new and improved culture test, the gold standard, to our lactulose breath testing. And lo and behold, they came out with the same results. So earlier on, they weren't, because the gold standard was so terrible. So all along, the breath test actually has been a better test than the culture test. So now finally, he has published research that has shown that has validated the breath test against the gold standard test. The problem is that, are the doctors who say the test is unreliable following this research? I mean, this is the newest research, you got to be into this stuff. I mean, I put out all studies, I put 4 times a year in my newsletter, I put out all the new studies, but are those practitioners who saying that, are they following that? Do they have this information? They probably don't. So, I can tell you from the hottest, newest research and from years of clinical experience, the test is completely reliable.
Excellent. Thank you. Thank you very, very much on that. Okay. Okay. A lot of you are not a lot, but several of you, because I know this is on your mind because I've mentioned it and it's on our minds, SIFO and Candida, all of these sort of things that look like SIBO. They're questions, Dr. Siebecker, of what do you treat first? Because remember, parasites and SIFO, I have found to be the most common mimicking symptomatic profiles of what people have with SIBO.
I'm grabbing a piece of paper.
Grab a piece of paper to your heart's content. Okay. The question I'm going to ask her is, which do you treat first? And for the next 20 people who sign up for the course, sorry, I'm a show host at heart as well, I will give you a PDF of my book, Healing SIBO. Would love to have you experience that. There you go. This is a quick read. It was, by the way, on the PDF, it's going to be searchable even. Oh my gosh, like that's amazing. I haven't told the publisher that I'm doing this, so don't tell them. But anyway, that's for 20 people. And it does take you through the algorithm. I mean, obviously it's not as intense and as special as the course, but it's a great quick reference guide. So next 20 people who sign up for the course, there you go. All right. Amber, Amber, go ahead and email us at info@sibosos.com. I'll hook you up with something. Okay, so Dr. Siebecker, go.
Yes. Okay, so the question was, what order do you treat like various infections? And I always have to get my piece of paper. This is from Dr. Klinghardt, from his information. So what he says, he's veteran, incredible alternative medical practitioner. He says you treat, first you treat big to small. So first, in terms of the size of the infecting organism. So first you would treat parasites, then you would treat yeast, then you would treat bacteria, and then you would treat viruses. Now, when I tried to look up the sizes of various yeasts and bacteria, I found that sometimes it's back and forth. So I think you could switch that. I honestly think when it comes to yeast and bacteria, you could do them in either order. And so people who have SIBO many times also have parasitic infections. It's very common. And they also often have yeast overgrowth. When the yeast overgrowth is in the small intestine, then it's referred to as small intestine fungal overgrowth. And that is abbreviated as SIFO. And so many people have these at the same time. And then there can be even long-term viruses as well. More commonly, I see parasites in yeast that go along with SIBO. So it's always a question what order to do things in. And I'm sharing the information from Dr. Klinghardt. He's, I only treat, I focus on one thing, which is the bacterial. So that's why I bring in someone else's information when they're treating everything. But I have treated a lot of yeast as well, the SIFO, and I found you can really do it either way. I do tend to either do them together or I do the bacteria first. And the reason why is because in my experience with my patients, I have found that yeast treatment takes longer and there's more die-off. So when you give a killing agent, a person can feel sort of like a detoxification feeling, just an awful feeling. And that can slow treatment down. That can happen. It does happen with SIBO too, but it tends to be worse with yeast. And so to avoid it, what many people do is they start the antimicrobial treatments or the anti-yeast treatments at very low dose and slowly ramp up over time to make sure they're not giving somebody all this die-off. And so then that takes time. So often it's a bit easier, even with the multiple rounds of treatments that are needed for SIBO, we can usually get symptoms to start coming down within about 2 rounds of treatment, and it's not that long. So a lot of times I will do bacteria before yeast, or I'll do them at the same time. So the answer is there's no one standard way, okay? And that is the most frustrating thing for a patient to hear, right? But we're complex beings and everyone's situation is different, but that is the advice that I have.
Okay, great. Thank you. Question about, could you please define what IMO is? I know you're going to spend more time in the next
Absolutely.
training, but define what IMO is, and does the training of the SIBO Recovery Roadmap and the course address IMO? And why aren't you guys saying it more?
Okay, so IMO stands for intestinal methanogen overgrowth, and the course addresses it. The SIBO Recovery Roadmap course that is for patients that we have addresses it. And the reason it addresses it is because that is methane SIBO. So I haven't just described this, but there are several types of SIBO that are based on the gases. The gases are hydrogen, methane, hydrogen sulfide, and a combination of gases. All along, we had these types of SIBO, and one of them was methane. But then a couple years ago, it was put forward that we should have a name change for various nomenclature reasons, technical nomenclature reasons. And now we should call methane SIBO IMO, intestinal methanogen overgrowth. It is technically a much more correct name for that archaea. It's not a bacteria, it's an archaea. So we absolutely address it because we always have addressed it. We just have a new name. So the reason that I don't say IMO constantly is because it's still new to me. And for 11 years, I've been saying one thing. And so it's hard to learn to say a new vocabulary word. That is why I'm sorry. To me, it sounds clunky to say SIBO IMO all the time. There are a lot more nuances with this that I will describe in the next webinar.
I do know, and if Joan's here from our Facebook group, I do know that there are a few patients that I've encountered who are very savvy and who are very upset. Upset is too strong of a word, but like, hey, why aren't you? It's a different disease. Because Dr. Pimentel said it in a webinar once, that it's a different disease. And I understand why he said that, but
I actually have a lot to say about that, but I was sort of saving it for the next webinar.
I know.
I have a whole discussion about this. Should I just go into the whole thing?
No, because I still have like 100 questions for you. Okay. So come to the next training because it's really epic as well. But the thing is that, you know how I talk about SIBO panic? If you've ever come to any of my little Q&As or whatever, we have a new name for it. They're called cozy tea times, cozy times, where we do some brainstorming sessions in the Facebook group and stuff. So don't have SIBO. I'm saying this to my younger self. Okay. Try not to have SIBO panic. I understand what it's like to be afraid about putting the next piece of food in your mouth because you're not sure how it's going to react. I understand the brain fog. We understand it, but there are answers. This is why we do this. There is
I think I can give you like the distilled
do it.
grain.
Okay, great.
For me, for hopefully calming some of the concerns with this emo terminology where people are saying, oh, it's a new disease.
Mhm.
It's not a new disease. So what Pimentel is saying is it's a different disease than SIBO. And there are medical reasons why he's saying that. And
Right.
I will explain that further. I don't want to take all the time now because you have a million questions. And I'm planned to speak of it later. But I think what could calm people is to know it's not new. It's the same exact thing that it's always been under a different name, which is methane SIBO. It's not new. But it has a new name, and it is different than hydrogen SIBO. We've known that all along. We've known that all along.
Yeah.
So none of this is new. It's what's new is the name. And so, so don't think it's a new disease.
We can just exhale, right?
Yeah.
Like just exhale. Like
yeah.
we have enough other
I understand how confusing it is, but I
yes.
think that might be what's freaking people out is they're like, oh no, what do we do? The same thing we've always known that we do because we already know what this is. It's just a different name.
That's it, Allie. Allie's got it too. Okay. Why can you lose weight with small intestinal bacterial overgrowth / IMO?
There are many reasons. What everyone thinks of first off is because they go on the Sibo diets, which have low carbohydrates. Low carbohydrate diets are typically weight loss diets, like such as Atkins diet and South Beach diet. You know, there are a lot of famous weight loss diets where they're reducing carbohydrates. So we can lose weight when we reduce carbohydrates, and these diets can do that. Now, I will have to say, the diets don't have to do that in and of themselves because the way they are written, you can get plenty of calories. So the real issue here is what happens is people actually restrict their diet even further than what is recommended by these SIBO diets as they're written on the page, because they are desperately trying to avoid their symptoms. So what we're really talking about here is, severe restrictions of diet, reducing carbohydrates. And what also happens is people reduce their overall food and they skip meals because eating triggers the symptoms. It is completely understandable. So that is one of the biggest reasons why people lose weight. Now, another reason is because of the symptoms. Some of the symptoms that SIBO have can cause weight loss. The first one would be nausea. When you have nausea, you can't bear to eat. So again, you're not eating. You can't. It's sickening. I mean, if anyone can ever remember when they're nauseous and then you can't eat. So then you're reducing your overall calories. Another thing is many people have terrible diarrhea. When you have consistent ongoing diarrhea, you can't absorb your nutrients and you lose electrolytes, you lose your nutrients out the other bottom end. So that is another reason for weight loss. So there are multiple reasons for weight loss in SIBO. It's a really very significant problem in a large proportion of patients. And I know anyone who's gained weight is mad when they hear me say that, but as a medical practitioner, as a doctor, it's quite a concern.
It really is. It really is. I'm just going to get a little more light in here. Okay, so thank you very much to those of you who have just signed up for the course, and you're going to be getting that last chunk of 20 is going to be getting my book in PDF. Yay! I'm very excited for you. And it was a labor of love, to say the least. And so I want to just encourage you to continue to evaluate whether or not the course would be right for you. Remember, everybody who signs up now in this, I call it a cohort or a semester, is going to be getting 8 Q&As. Now, here's what's also cool. Dr. Siebecker updates this course periodically when it's relevant and appropriate. And fortunately, there's been some really great informational changes lately. And then also last year, we did not do Q&As, maybe 1 or 2, I can't even remember. But this year, we really wanted to make up for it because once you're in, you're in. So like, heaven forbid you relapse in another year, you're still going to be able to come to the Q&As we do. Now in this is very special because we're doing a bunch in 2022. And so the previous students are going to be invited to 6 of them, but the people who sign up right now, you're getting that extra 2, which will therefore be a smaller group. So this was something we were very happy to be able to do. We have the dates. Once you get in, you would see the dates and all that. And if you can't make it, that's fine. You can pre-submit your question. And they're very clear ways of doing that once you get in. Okay, so the next thing that I wanted to share with you, if you do join us right now, is that for that first month after, like starting in February, I'm going to be doing 4 what we call tea cozy happy hours, which is really just a silly term that makes me happy. And that's going to be brainstorming sessions with me. I'm not a doctor. I'm a patient advocate. I'm a fellow, patient along with you. I'm an author of this topic. And we can brainstorm what's going on for you. And I can sort of look at the algorithm and you can pick my brain about what to do next. So we are going to be doing some of those starting in February, and that's also included. Now, we've never included those before, and this is just for this group. So Dr. Siebecker, do you think that's a good bonus? Like, Dr. Siebecker had to talk me into it because I was like, who wants to talk to me?
I think it's an incredible bonus. You have so much information, and also you're so good with the mindset and the attitude, and people need, it's like a support group, but also you are so knowledgeable. You wrote a whole book. I mean, for gosh sakes. And also you interview all of these. We do all these classes and you do all these interviews with the tops in the fields. You have so much knowledge to impart.
Thank you. That was a good setup. Thanks, Dr. Siebecker. Pay $1 later. Okay, Jean, thank you for coming to this training, Jean or Jeannie. Jean, so you already have the SIBO Recovery Roadmap. You will have 6 Q&As this year because you're already a student, and your updates are already in the course. So we've sent you an email when we update it. So maybe just check to look for that, but mainly go to the course, get your login, pull that out if you haven't been in there lately, and they're in there already. So that's cool. All right. Okay, Trisha, thank you. Thanks, Carrie. You guys think those would be good bonuses. Okay, good. I feel better. All righty. So next question here is, what is the deal with leaky gut and SIBO?
So SIBO can cause leaky gut. And we know this from a couple of studies that were done. I really wish there were more studies on this. We have 2 primarily just on SIBO and leaky gut. There are more that look at other conditions, but then it's not clean data. So what we saw in the 2 studies is that about half of the people with SIBO can get leaky gut. Now, this was surprising to me, because I would have assumed it would be everybody. I just would assume the number would be higher. So it's actually really lovely, good news. Not everybody that has SIBO will have leaky gut, but SIBO can cause it in about half of the cases of people who have SIBO. This other super good news was that what they did was they treated people with an antibiotic for 2 weeks, and then about a month later, they retested to make sure their SIBO was gone, and they actually eradicated the SIBO. So no longer did they have SIBO. Then about a month later, they retested the leaky gut, and they saw that in a very high percentage, it was gone. So that showed that the SIBO in these people, the SIBO was causing their leaky gut. So in one study, it was 100%. You never hear that in a study. It was gone. But then in the second study, it was something like, I don't exactly remember. I think it was something like 70%. And so what does that mean? That means that there are other reasons to have leaky gut. There's a huge list of things that can cause leaky gut, and people can have more than one thing wrong with them, as I was saying earlier. So in cases like that, they have another reason of something that's causing leaky gut because the SIBO is gone. So that's the relationship between the 2. If for most, the vast majority, if you can eradicate the SIBO, you will eradicate the leaky gut.
That is amazing. The other thing is sometimes people with fructose intolerance. So I did a fructose intolerance test while I was in the middle of like raging SIBO, and I was the highest you could be. I was like off the chart. And I just sort of put things together after talking to Dr. Siebecker that once the SIBO clears, you're not fructose intolerant anymore.
Right. So
that blew my mind, right? I thought they were really separate.
Yeah, well, they can be
Of
because
course
there
they
could
can.
be
Yeah.
genetic
Right.
lactose malabsorption or fructose malabsorption, but SIBO can also cause and often causes lactose or fructose intolerance and malabsorption. And then what that means, that's called secondary. Earlier, I gave you an example of primary lactose malabsorption. That means it's genetic. You're born with that. You basically, after a certain age in that situation, you don't make the enzyme lactase that digests lactose anymore. It's common. It's actually very common in the population of the world. So secondary lactose or fructose intolerance and malabsorption is when you have a disease that is causing you to have that. And then when you get rid of that disease, it will go away. So that is the case with SIBO and lactose and fructose malabsorption, so long as you don't have primary, right? Because if you have
Right.
genetic primary,
Right.
you could have had
Right.
both. But it's remarkable. There's studies on this with SIBO, that you eradicate the SIBO and now they can eat lactose containing foods again and fructose again. And that, that's what we're trying to do. We're trying to eliminate. That was the point of the whole algorithm. Get rid of it. Get rid of
Right.
it. So
Right.
you can
Exactly.
then tolerate
Right.
these foods again.
Exactly. Okay. All right. So let's see. Brain fog, Lori, go ahead and sign up for the third webinar if you haven't already. How can you find out? Email us at info@sibosos.com. Histamine intolerances. Can we talk about that and SIBO, small intestine bacterial overgrowth, and the IMO? A lot of people find that they didn't have histamine intolerance before, and now they do from having this condition. What do you think?
Yeah, SIBO can also lead to histamine intolerance, and it's really unfortunate, isn't it? And now I've just already mentioned a whole bunch of things SIBO can cause, right? More reasons why we want to eradicate it. The reason why it can do this is because DAO, which is an enzyme that breaks down histamine, sits on the tip of the villi in the intestine. So I don't know if any of you ever studied intestinal anatomy or microanatomy, but do you remember the analogy that the inside of the small intestine is made up of fingers and hairs? The fingers are like a shag carpet, and they are the villi. And so, like, just imagine the inside lining of the small intestine looks like a shag carpet, and this allows us to absorb our nutrients. On the tips of these villi is where we have this enzyme DAO that breaks down histamine. And in SIBO and EMO, a lot of damage can occur to the lining of the small intestine, actual, structural, physical damage due to the activities of the overgrown bacteria and archaea. And this enzyme can basically be reduced in amount and even go away. And so then a person is not able to break down their histamine properly. And then that would lead to histamine intolerance. Histamine intolerance is a huge category. And I think we have a training that's going to be coming up on that by a specialist in it. But so if you're interested in that, I'd encourage you to watch your inboxes for that. But just its relationship to SIBO is this: SIBO can cause histamine intolerance. And again, once you eradicate that SIBO, the intestines are quick healing, very quick healing. So I would expect 2 weeks to a month, you would start to see a difference once you're eradicated on your SIBO. Just like leaky gut.
Right. Can you talk about iron levels, low ferritin with SIBO and what you have observed? So, and explain what ferritin is, if you would, please.
Yes. So SIBO can also cause it can cause anemia, and it can cause low ferritin. There are different types of anemia. B12, folic, and iron. Those are the 3 types of nutrients that when they're deficient, that would be called anemia. And SIBO can cause B12 deficiency anemia, and it can cause iron deficiency anemia. It does not cause folic acid deficiency anemia because the overgrown bacteria in SIBO, not in EMO, just the hydrogen ones, can actually make folic acid. They do make folic acid. So that is not common, but we see the others. And so, and actually high folic acid, if I'm remembering this correctly, high folic acid used to be the test. I'm going off on a tangent, but it's interesting.
Fine.
Used to be the test that was used in veterinary medicine to identify SIBO in animals, because animals can get it too. In fact, in cows, it's called bloat. believe it or not. So we all know why it's called bloat. So, anyway, pre-iron deficiency anemia is low ferritin. And so that's just ferritin is the storage form of iron. And if the storage of iron is getting low, then that is, that's like a problem. That means you're heading towards anemia. And so SIBO can cause this. It can cause low ferritin and it can cause anemia. And again, once you eliminate, we have seen this in our patients. We actually had Dr. Sandberg Lewis and I published a case on this back in like 2012 or something. Once you eradicate the SIBO, and eradicating the SIBO means your test is negative, right? That would be how you know you've eradicated it. That's how they do it in the studies. They retest and make sure that the test is now negative. Then your anemia and your ferritin can come back to normal. Now, there are lots of other reasons for why a person could have anemia. I mean, oh my God, there's so many reasons, or low ferritin, but SIBO is one of the reasons.
Okay. I'm going to show you guys something really cool in about a minute, but Sarah is asking about genetic links for SIBO. My mom, 80 years old, still is struggling with IBS, never gets relief and gets blown off. I'm so sorry.
I'm so sorry.
And then it's the whole elder prejudice. Believe me, my father was 69 years old when I was born, so I saw it all the time. I just recently got diagnosed with SIBO. I suggested she gets a breath test for Sarah. Can I just tell you quickly my theory, which you probably have thought about a bazillion times, and I felt like I had a new idea. Of course I didn't, not in this anyway, is that maybe the whole family all had the same meal and got food poisoning together. Okay, so that's the only like genetic thing that I could think of, but I'm not a doctor. What do you think, Dr. Siebecker? Is there a genetic predisposition to it?
The way there can be a genetic predisposition is there are some genetic diseases that can cause SIBO. So, like for instance, Ehlers-Danlos syndrome is a genetically inherited by genes, the predisposition to have that disease. And if you have that almost always causes SIBO. So, there are diseases. So they would be from family to family. I have seen that. I have seen cases. I saw a case of a mother and daughter. Actually, they did all get food poisoning. But the husband and son did not go on to develop SIBO after the food poisoning, whereas the mother and daughter did, and they both also had Ehlers-Danlos. So they had a structural circumstance. I know I'm not explaining what Ehlers-Danlos is, but it's basically like loose, loopy, prolapsed bowels. The movement doesn't go well. It's kind of stasis, and bacteria can build up, and microbes can build up. So anyway, they had a genetic that could have caused them to have SIBO even by themselves, but then they got triggered by having the food poisoning.
Right. Hypermobility syndrome is another name that is associated with Ehlers-Danlos, and we have something to tell you about that in the course. Okay. I want to show you all something very cool right now, and then we will wrap up, because I know a lot of you are staying until the end. Thank you to get the handouts, and I really appreciate it. Here it is. I wanted to show you this. So this is the push the button, Shivan. This is the expanded version of the SIBO Recovery Roadmap, the algorithm that Dr. Siebecker has been teaching from today. This is the coolest thing. I'm so excited about this. You can click. So when you're enrolled in the class, these are active links that can take you to, here we go, lesson, we'll do lesson 5, that take you to the thing that you're looking for in the course. So yes, you can just use this course normally, go segment by segment. It's very straightforward. It's incredibly organized. But here is that algorithm that can take you. Can you see that right now, Dr. Siebecker? Did I do that right? Oh, my sharing paused. Hold on.
No, you're sharing. Oh, wait, you were sharing.
Oh, I was sharing.
Now it came off.
Okay.
I was seeing.
So you click the link in the elaborate algorithm, and we linked it back to the lesson. So you really can take where you are on the algorithm and go right to the information you need. And this is what the inside of the course looks like. It's so you see yourself with the blue shirt right now, Allison, right? Is that what you see? Yeah. Okay, good.
Yeah.
So this is the SIBO types, for example. Here, Dr. Siebecker is talking about the levels of treatment. This is the roadmap overview. It looks a little bit different than the one we just showed you today because it has been updated, but with just like some like flourishes, it's the same as what is in the course. This is the third line therapies Dr. Siebecker talked about. Now, for example, 4 minutes. Yeah, that's cool. So you can get in and you can get out. This today has gone on for a really long time, and I hope you've enjoyed it as much as we have. But she wanted to make everything very succinct and very easy. This is about anemia, by the way, for the person who is asking about that. Treatment symptoms, level 5, I already did that one. You get the idea. Chronic and acute versus others, how to talk to your doctor. We have some very in-depth information there. And remember, it's getting updated all the time. So I just wanted to show you the inside of the course because, it's nice on HSN, when I sell things, it's not radio, right? It's show business. So we wanted to show it to you. That's what's in my head. So we have lessons on prokinetics, what to do if you're not feeling better, more on prevention. And of course, that is what I wanted to share with you. Please join us for this course. It is amazing. It is effective. It is the algorithm that is proven. We have the link to join in the chat. And I know we have a lot of people still here. Go ahead, Clarissa, if you would, thank you for staying with us. Would you please put the link for the handouts in the chat so everyone can grab that link? I know some of you are having a hard time with the cut and paste. Jennifer saying, if I already have the roadmap course, are the algorithms included in the updates to the course? That's in there. Yes, it is. You already have it. And the updated one is in there too, Jennifer. So yeah, it's into perpetuity. And yeah, that's
Shivan, I also wanted to mention, my eyes don't often see the chat, but I did see, a few times people popped up talking about the expense of rifaximin and how to get rifaximin. Yes. And we have information about that in the course, specific information.
Very specific. So I want to find the link that Cindy sent me earlier today, because what I'm going to do is, here's what's going to happen now. Is there a time limit on the course? No. What do you mean? What do you mean, Linda W? What do you mean?
I think she might mean you have to watch it within a certain time.
No, you don't. There's a limited time. So Clarissa, who's with us behind the scenes, might be doing something else right now, but she'll pop it in there in a second, Marcia. No, there's no limit, because I know what that's like. I feel like a lot of pressure if I'm like, oh, this is going to, expire in 3 months or something. But that was the opposite of what Dr. Siebecker and I wanted to accomplish. We wanted this to be there for you for the long run. And that's why we update it, because I know you have too, Dr. Siebecker, certainly picked up things, bought courses in the past that were great, but they were one and done. They weren't living and breathing. So I call this course a living, breathing course that continues to get like a bonsai tree or like a forest, cultivated and tended to. And this is really that inner circle access that Dr. Siebecker and I wanted to provide for people. It's self-study, okay, but that's why we're also doing the 8 Q&As for anyone who signs up right now. Like, for example,
self-study just means though that a person can watch it whenever they want to watch it, and then you can come back whenever you want to rewatch something.
Right. And that was the whole point. It's support, it's information. You'll have studies, you'll have what you can print out and take to your doctor. It is in US, yes. The cake recipe is in that link. And yes, there is a speaker. There is a speaker list of people who are SIBO specialists, so you can coordinate with them. Legally, this is important. Okay. Legally, I was told that I should not recommend doctors because I could get sued. So I am, that I pay attention to that. So we call the list of people who have contributed to the speaker series and the summits that we've done the speaker list. They are speakers. because they have spoken in our events. We will leave it to you to look at the list, and you will be able to figure out who is a good fit for you based on their websites, based on talking to their front desk. We talk all about this in the course. So Clarissa has put in the, thanks Clarissa, the chat, the handout information, as well as the information for ordering the course. Carrie is wondering, will I get the Q&A sessions if we sign up for the course before the end of January? Yes. If you sign up for the course, wait, no, it's the 26th is the very last day. So I'm saying January, I need to be more clear. It's the 26th at midnight Eastern time. That's the cutoff. Let's say anybody's listening to me right now. We haven't even told you guys yet. If you already own the SIBO Recovery Roadmap course, you are getting 6 Q&As next year. So if you are brand new, you're getting 8, because the first 2 we wanted to have be smaller so that you all could get some extra attention. And then we open it up to the entire student body. So that is, did I say this year, 2022? Yep, for this year, 2022, right. Okay, I hope that helps. And it'd be helpful if we stuck with a 2-hour timeline. I know, Pauline, I'm sorry. We just had so much to share with you. Okay, so we'll do it tomorrow or the next time we're doing a training, I promise. People who stay for the 2 hours will get you the handouts at the end. I'm gonna write that down, 2 hours. We just love to give you the information. We love to over deliver, right, Lena? It's so much information. Okay, here's what I'm gonna do. I'm gonna try to find that link that you made for me. Cindy, you made me a special link. Okay, don't anyone leave. I'm just going to do a proper thank you, and then I want to tell you something. So thank you all. Please leave some feedback in the chat for some love for Dr. Siebecker. Thank you, Dr. Siebecker. You are amazing. We will see you all in the next training. I'm going to stop the recording. Thank you all so much, and we'll see you soon.